This conference will now be recorded.
Hello, doctor. There's no sound.
Okay, can you hear me now?
Yes, doctor.
Perfect. Sorry.
Yes,
So in the first scenario, we will apply two things. What are they? What are they? Done. There, done, done. What are they? Relevant history and how to manage. Guys, if you get low mark in management, it's not usually because you did not have management. No, no. It's because number one, you manage the patient according to your own script. You did not apply the management on the patient himself. I will tell you now how. And it's because you did not communicate with the patient. There is no communication at all. So management has to be two-way conversation. In the management, the patient must talk. The patient must say something. The patient must, if you just in management talking yourself, the station is gone. Because it's called the management plan. So relevant history and management. Now, in this station, okay, the doctor will come out, will apply two things. Relevant history. I don't want the questions that are not related to my topic. And what? Management plan. I will give you simple structure about relevant history. Simple. Can you please write it down? Simple. And that's all we're going to apply. Simple structure about relevant history. Can you please write it down? Write down presenting complaint. Presenting complaint. That's what I want to know. Explore. Write down associated symptoms. What is the meaning of associated symptoms? It's other symptoms he has. It's called associated. That's not differentials. For what do you mean? I have doctor, I have headache, for example, and PLAB Revision. That's PLAB Revision is. So I need presenting complaint. I need associated symptoms. Concern right after concern. Concern should come after the associated symptoms. Dr. Mo, why should I ask concern early? Because if the patient is concerned about a certain condition, you want to ask him differential about this symptom to exclude it. So concern. After concern, write down. After concern, 3 or 4 differentials. How many? 3 to 4 differentials. How many? 3 to 4 differentials. After that, write down red flags, flows, then P2, 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 then allergy. Write down. Look, I said P2, P2, and the allergy and medications, which means the last line I said. Write it down. Medical condition, medication, allergy. P2 plus allergy and medication. It is what? What is P2? So write down medical condition, medication, allergy. That's easier. Medical condition, medication, allergy. Plus or minus. What? Plus or minus. DESA and the rest of مفتوح. Plus or minus. DESA and the rest of مفتوح. I think it's very clear now. Salam alaikum. Presenting complaint. After that, associated symptoms. After that, main concern. 3 differential, medical condition, medication, allergy. That's it. That's it. DESA and مفتوح. Plus or minus. What do you mean? A female is coming with discharge from the front passage. How's your diet? Do you do any form of exercise? Questions irrelevant, especially that the patients are trained. How's my diet? I eat healthy. And you? I should be a wolf. What do you mean by healthy? Then you go into, and then you waste your time. Okay? A female is coming, or a patient is coming with abdominal pain. Abdominal pain. Is really that important? Is it important, diet? Yes. It is important. It is important. It is important. It is. Is it really? The way I ask them, is it really important? Guys, just to wake you up, yeah. I don't know. No, the way I ask you, is it really important?
It's a thought insertion.
So, please, relevant question. So, DESA is relevant. What you need from a patient is coming with cough. Cough. Diet is important. You see what I'm talking about. Smoking. Yes. So please, DESA is, and by the way, we know that it's not only DESA, it's DESA plus DESA and IV drug abuse and sexual history. Yeah. So please, relevant. Maftosa, again relevant. When you ask your patient, trust me, you will know if you need this question or not. You will know. A patient is coming with, for example, headache, and when you take in history, it's chronic. You're suspecting something going on. You're suspecting something chronic, not acute. For example, tension, whatever. Do you need diet? You need diet because it could be hypertension, it could be no. So smoking, yeah. Yes, you need. So my point is, take what you want from this, but is a must. Bismillah ar-Rahman ar-Rahim. Complain, associated, concern. Did you maximum 4 red flags? Look, they come like medical condition, medication. Any medical condition? Are you on any medication? Any allergy? And my history now is done. Then the rest? Depend. No, the rest of DESA, maftosa, that's like 2 minutes. DESA and maftosa, 2-3 minutes. If you ask all of them, you need 2-3 minutes. Do you agree with me?
Yes.
So, no, that's relevant. That's whatever I want. And don't worry. Now you know it's relevant. So when you talk to the patient, when you look at when the patient's coming with a complaint, if you ask diet and you know it's not related, you will feel it. I mean, diet and other things that not related to diet. So please make sure you select. However, what if I ask one irrelevant question? That's not Bible or Quran. It's fine. Nobody's saying, oh my God, one irrelevant question. Mark him down. No. But at least now you know that I don't want to have my history to be irrelevant. I need some of it. Okay, I will miss it. I will say, ask a question that is not relevant. It's fine. I said it, but not everything. So let's start with the station. And now we need the doctor will come. And after my history, what should come? Expectation. After my history, what are you expecting from today's consultation? I'm refreshing things that you forgot. Why do I need to ask the patient about his expectation?
You might have.
No. Because it will help me in management. Yeah. Doctor, I'm actually expecting a CT scan today. So it will help you in reading his mind. And then examination, verbalize. Then after verbalizing examination, what comes? Sorry? Perfect. Ideas. Do you have any idea what's happening? But sometimes ideas will be awkward to ask. What do you mean? If the patient main concern is MI, do you have any idea? MI, I told you. But if the patient main concern is different, which means a patient would come with a chest pain. If he said to you, my main concern, heart attack, then you cannot say, do you have any ideas what's happening? Because it's heart attack. But if the patient is coming with, for example, headache, and then you ask him, what's your main worry? What's your main concern? Doctor, is it contagious? His main concern, can it come to people around me? Then the idea is different, because the idea is the diagnosis. Do you have any idea? It means you know what's happening with you. Guys, did you get this? Because it will be very irrelevant. Did you understand what I mean by the idea could be the same as concern, but sometimes it's not? So if the concern is a diagnosis, can you ask idea? No. If the concern is a condition, my concern is cancer, can you say to him, do you have any idea what's happening? No. Cancer. You understand? Yes. They don't sound the same because, again, what's your main concern? Doctor, is it tension, headache? What are you expecting? CT scan. What are you expecting? Expectation is management. It's kind of investigation. What do you want today? You know? I'm concerned about my job. So, yes, so let's start the station. And we need short history and we need relevant or two-way conversation management. Okay? Who wants to come? When is your exam? Okay, good, close. Yeah. Can we, if you don't mind, just push this back a bit? Back. I'm sorry. No, a bit backward, like. So I can. Are you comfortable?
Yeah, thank you, doctor. Thank you so much for your concern.
Now everybody will come here outside. Give your phone to one of your colleagues if you want, and ask him to record you on your phone. Why?
To see yourself.
Is it working? Yes. It is working. Perfect. Okay, guys, try all the time to have yourself recorded. You're gonna use that one just for everybody to hear. Guys, can you hear now? Yeah.
Yes.
Okay.
Dr. Mo told you to record yourself.
No, I'm saying optional. When you come out, it's affecting the phone consultation. Okay. Gonna switch off because the phone consultation, the mock examiner is in one of these rooms and this mic is everywhere. So okay, but we need to raise your voice a bit.
Okay.
Okay. Yeah, when you record yourself, that's when you record yourself. That's when you exactly see your mistakes. When I say your mistakes, I mean communication wise. Oh my God, I was panicking. I was quick. I was fast. I was, Okay. Relevant history. That's our message now. What is our message from this session? Relevant history and management and good management. Good management. Okay. 45 years old. Alex Thompson presented with a concern. Nowadays in the GMC in the exam, they bring concern. Why? So you don't think outside. You don't plan ahead. Okay? So concern. Yeah, and if you can, please raise your voice as much as you can. So okay. Yeah. So I just want them to all benefit. Yeah. Yeah. Okay. Write the feedback on the doctor now. So yes.
Okay. Timer.
Timer. دكتور عمر الصبحي بقى كان يا عمر باشا.
في صفحة تانية.
في وير از
سام.
هو دكتور سامح هنا؟ وير از هي؟ دكتور سامح هاو ار يو حبيبي؟ يو اوكي؟ ناو وي هاف دكتور صبحي تايمر.
Can adjust the time. 2 minutes من هناك.
Yes.
Sir,
Dr.
we are
Sam,
missing him as well.
you are what? Missing him as well.
We are missing, yeah, we are missing Umar as well.
دكتور عمر الصبحي, دكتور نهال, all of these guys, but it's time to move on now. So yes, let's start. Yeah, let's start.
Hello there.
Hello, doctor. Hello.
My name is Siwar, one of medical team doctor working here.
Hello, doctor.
Can I get your full name and date of birth, please?
My name is Mo Sobhy.
Okay.
10th of January 1975. I'm 45 years old.
Hello, Mr. John, Mr. Mo.
Yes, doctor. Yes.
How can I help you today?
I'm just having this headache, doctor. It's really bothering me. It's just, it's all around my head.
Yeah, I guess.
And yeah, it's just like when it comes, it's really annoying.
Yeah, I can see that you're very uncomfortable.
Yeah, I'm okay now, but it's even when I think about it, it's been there for 4 months.
Oh.
For 4 months, doctor. Every time when I'm going to work in the morning, I have this bad headache around my head.
Oh, I'm sorry to hear about that. So it has been 4 months now.
Yes.
And did it start gradually or it was sudden?
Well, started all of a sudden,
Okay.
but just only 4 months ago.
Okay, and it's all over your head.
Yes, doctor.
Okay, and it has been continuous or it's like on and off?
It's on and off.
Okay.
It goes on its own when I'm going home.
Okay, and what's can you describe it, the type of pain?
It's band-like headache. It's like all around my head.
Okay, is there any particular time of the day that you think?
In the morning.
Okay, it's most in the morning. And have you noticed anything to bring it on?
Yeah, I've just mentioned to you. It's every time I'm going to work,
Yeah. Okay. And have you tried anything to ease this pain?
No.
Okay. And on a score of 1 to 10, can you please score your pain for me?
It's like 1 is what, 10 is what?
Yeah, sorry. 1 is the mild pain that you have, and 10 the most pain
It's
that
about
you have.
5.5, 6.
Oh, okay. And apart from that, have you noticed anything apart from headache?
No, just a headache.
Okay. Is that the first time that you have this kind of
Yeah.
headache for this long period of time?
I've never complained of headache before.
Okay. Anything else along with headache?
No.
Did you vomit?
No.
Okay. And do you feel like there's a problem in your vision?
Not really. I wear my glasses and I've never changed my glasses recently, and no.
Okay. And do you have any other any idea about what it could be?
Not really, no.
Okay, that's fine. And what's the most thing that worrying you today? Because you know you are.
I just want to know why is this happening, because it's affecting the relationship between me and my partner. It's really making it like, because when I have this headache and it's really like I feel frustrated at my partner all the time. I don't have normal conversation with my partner all the time. So I just want to solve it, because it's coming to an end with my partner now, and I don't want this to happen.
Oh, I'm sorry to hear about that. I hope we help you into that. So you mentioned that it affects your relationship with your partner. And how about your mood?
No, my mood is perfect. Yeah.
Okay. And what do you do for a living?
I work as a doctor.
Okay.
Yeah, orthopedic.
Okay.
Yeah.
That's good. And have you been diagnosed with any chronic medical conditions?
No. I mean, apart from high blood pressure, nothing. Just high blood pressure.
And are you managing it?
Yeah, I go to the doctor. Yeah.
Do you take any medication so far?
Yeah, I'm taking amlodipine. Yeah.
Okay. And is it managed? Is it controlled?
Yeah, I go to the GP and yeah.
Okay. And are you allergic to any medication?
No.
Okay. Apart from that, is there anything in your mind that you would like me to share?
Not really, no.
Okay. So going to your lifestyle, can you tell me, do you smoke?
Well, I don't know.
Okay. You don't know?
No, I don't. I said
You
no,
don't,
I don't
sorry,
know.
sorry.
No, I don't.
And
know.
do you drink alcohol?
Well, I do, yeah.
Can you tell me?
Well, every day in the evening,
Mhm.
I drink like a glass or 2 glasses of wine.
Okay, and is it related to something, or it's
No,
that's you used
it
to?
chills me out, it relaxes me.
Okay, and it's increasing. I mean, recently.
No.
Okay,
Every
it's the
day,
same.
2
Okay,
glasses of wine.
okay. And do you do any kind of physical exercise?
Not really, no.
Okay, that's fine. So I would like to examine you and observe your vitals, blood pressure, temperature, your BMI, and I would do a general examination and a neurological examination. Would that be okay?
Yes, doctor, yes.
Okay.
Everything is fine. Blood pressure is a bit high,
Okay.
150 over 85, 90. Yeah.
Okay. Thank you, Mr. Mo and Dr. Mo for coming. And taking into consideration what you told me, and after I examined you, it seems that everything is normal in your examination, apart from your blood pressure. It's a bit on the higher side.
Oh, okay.
So I think we can have a chat in order to see it could be one of the factor that or the causes for your headache. But what I'm thinking of actually, you've described it's like band-like headache, and you're drinking too much alcohol daily. So it could be I don't know if it's hangover. It's not hangover. It's tension headache.
Are you talking to yourself, doctors? Are you okay?
Sorry, yeah.
Okay.
It's tension headache.
Tension headache, okay?
Yeah.
Okay.
Okay.
2 minutes remaining.
So what I'm thinking of, it's actually one of the commonest headache in patients.
Okay.
Okay, so it's normal to have like such like headache,
Yeah, okay.
and we can give you like some advice regarding your lifestyle,
All right.
as well as painkillers,
Okay.
simple painkillers.
All right, okay.
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 And would you like it? What would you like me to?
The lifestyle.
Okay, so that's good. So since you've mentioned that you're drinking alcohol like 2 glasses daily, so have you ever thought of cutting down your
No,
alcohol?
I love my alcohol, but I can think about it.
Yeah, that's good actually, and we can help you to refer you to alcohol cessation clinic, so that you can like decrease the amount.
Okay.
And your headache hopefully will get better.
Okay.
Okay. And the other thing, the simple painkillers. By that I mean the ibuprofen and paracetamol. But if at any time if you feel like your headache is getting worse, or it causes some weakness in parts of your body, or you are not managing your headache, please come back to us.
All right, okay.
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 Anything else in your mind you want me to
No.
discuss?
No.
Okay.
Yeah.
So did I meet your expectations so far?
Well, yes, you did meet my expectations.
That's good. That's good. And I hope you feel better soon.
Thank you very much. Thank you.
Thank
What's your name?
Siwar.
Huh?
Siwar.
Siwar. Okay. What do you think of Dr. Siwar?
Well done.
Okay. I can tell you from now, she'll pass her exam, inshallah.
Inshallah.
And I always have these things recorded. So seriously. So I can tell she's communicating well, you understand? You know what I mean by communicating well? Confident or not? Did you feel that I'm sitting with a GP? Yeah, I mean she's not like not sitting confident, you know. One thing that I don't want her to do, cross legs like you understand? No, seriously, that's one thing. Cross legs like this, no, you shouldn't be that much confident. You should be like a male would be sitting like this, yeah, not like this. A male should be sitting like this. You understand? Don't guys sitting like this. A female should be sitting the same, but females sometimes their hands like like this on their lap, for example. But you should not cross legs. You should not. You get me? You should not. So like this. Okay. That's one thing. The posture. Okay. I really felt it was natural. That's what I want you to pick. It was natural. It was not a simulation. She was natural. You understand? You know what I mean by natural? Not hesitating, not thinking. Did you have any allergy? And no. She was like looking at me, eye contact all the time. Okay. Now, relevant history. Her history is perfect in terms of relevant. In terms of relevant. So I gave her the headache. She did well presenting complaint, detailed. I don't know if you've seen or not. Severity, timing, anything that makes it worse, anything that makes it better, where exactly, onset, perfect, which not many of us do this. After the complaint, she went into the associated. Anything else? I said, no. She asked ideas early, but it's fine. It's not like, fine. She asked concern, however, active listening. I told her the word work in the first 20 seconds. She passed it. And then after like 2 minutes, when do you really have that headache? When is it the most? I said to her before work. But she should have picked it early. Early. And she should have like, Mr. Andrew, you've mentioned the word work there and then. There and then. You've mentioned the word work. You've mentioned the word that it's you have this headache before work. Can you please tell me, natural, what do you do for a living? Dr. Mo, my history will be not structured because I will go to work early. Ask it. No, it's fine. When you explore work, and because I said before work, she should have said, it's your work. Do you describe your job as stressful? Again, natural. Then after she explored work, coming back to your headache. Carry on with the headache. Why? Because if I leave it, I will forget to come back to work. And it's good when you pick it. So she left it. So active listening. I said to her, P1 great. Active listening, but by the way, intentionally I quickly work. I said it quick, but I want her to pick it. Okay? I said to her, wine. Did she explore it? How often? How many? And then she said, she asked a very good question, which I call it, I know what she's looking for. Recently, just before you started this headache, have you started increasing the amount? She's talking about if you always drink wine, why headache now? But maybe, yes, he increased his amount. That's what we want everybody to think. I'm telling her finally, think. So now, I give her 3 things. And when she came for differential, did she ask many differentials? She asked differentials for the chronic headache. Did she sit down and say, okay, Dr. Mo told us headache from outside to inside. Did you injure your head? No. Then after the meningitis. Did you? Then after that, But I was expecting 2 questions more.
Flows.
No, before even flows. I was expecting 2 questions. 2 questions I was expecting. And in your differential, because I give her chronic headache, so all her differential will be chronic. What do you mean? Vision? Yeah? High blood pressure? But I wanted 2 more questions. Only 2 words. Only 2 words, not questions. Fever? Dr. Mobat, it's chronic. Yes, I know it's chronic, but you need to always involve in your differential the most serious. With 1 question, not any fever, any neck stiffness. No, 1 question. Fever. Can you have meningitis without fever? Can you have meningitis without fever? No. So 1 question on fever. The second question, vomiting. Because she asked vomiting. Perfect. But I wanted not quick question. I wanted the examiner to know that you're looking for early morning vomiting, not just vomiting. Any early morning vomiting, because the headache is early morning. My headache is early morning. So I need early morning vomiting. Are you lost? That's it. Then she went for DESA, again relevant. Yeah, smoking, alcohol, perfect. Her history was, as we mentioned, P1 associated symptom concern, 3 differential, 4 differential. Then you need the DESA plus or minus, P2 medical condition, and then DESA plus or minus and maftosa. That's it, quick. She finished quickly, and her history, she started management early. However, in provisional diagnosis, and this is a message for provisional diagnosis, in the exam, you don't need to give 1 diagnosis. Again, in the exam, you do not need to give one diagnosis. And I always give this example up until, you know, the more you live, the more you learn, right? We agree? I used all the time to say to the doctors, give one diagnosis. Oh my God, you are giving me two diagnoses. But about a year ago, I went OSCE examiner, final year med school, Liverpool University. Yeah? And they gave me the station. It was PID, chronic pain. It was chronic female with chronic abdominal pain and discharge. Yeah? And they give me the criteria. What should the student do and say? And in the provisional diagnosis, they wrote for me that 3 differential. Number 1, PID. Number 2, STI. Number 3, IBS. IBS? Yes, because the complaint was chronic abdominal pain. And when you take history, there is discharge. There, you know, but again, they put for me as an examiner, yeah, the diagnosis in the form of differential. It was 3 differential back then. I was saying, oh, so stupid, like chronic pain and the discharge, and they giving me in my iPad like IBS. And then I asked the head, and he said, yeah, because we are putting the differential diagnosis, the provisional, in the form of the differential. It's always better because you cannot just give. It's not all situation you will be able to give one diagnosis. So I said to him, okay, but why IBS? He said, because we are giving this depending on the P1, which was chronic abdominal pain. My point is, the message is, then I started changing, because guys, please, in the exam, you don't need to give one diagnosis. You don't. Like in this case, I gave it to tell you, do I drink alcohol? Can it be wine? Yes. Can it be tension because of work? Can it be high blood pressure? Yes. So that's the provisional diagnosis I wanted. Mr. Andrew, from what you've told, like this, from what you've told me, headache can be caused by many things. Yeah. From the history that you've given me, you've told me that it's usually before work, and you described the job as stressful, and the way you described it for me, it could be tension headache. However, I'm really concerned about the fact that you drink wine every night, and also the fact that you have high blood pressure. So because these are 2 factors can cause headache. So let's take it that way. Look at the way I'm talking. Huh? We'll measure blood pressure to make sure it's controlled, to exclude this as a cause. Yeah, we'll try to work in the alcohol, and we'll try to work on your stress. What do you think of that? Yes, doctor. Then we'll follow you up, and we'll see. Yes, doctor. Which one would you like me to talk about first? Wine or the stress, basically? Because that's the station. Do you understand me? So you're managing both at the same time? Yeah, the station, I'm drinking alcohol every night. And I have high blood pressure. And in the finding, I give her hypertension. Yes, I give her 155 over 85. And the stress. Could it be one of the 3? Yeah. But she, which I didn't like, still tension headache. She still what? Said tension headache only. Am I making any sense? Yeah. So that's how I wanted to. Don't worry, it's not. I have to. Only you have tension headache, but you have hangover headache. You understand? But this is not hangover. My point is, please, as I said it, and that's what they want. They tell you all the time in the gym scene in the morning. Tell us how you are thinking. Yeah. Don't. We know that you know the script. Tell us how you are thinking. Okay? Tell us how you are thinking. So please, guys, professional diagnosis doesn't need to be one differential. And when you look at the scripts, plenty of scripts like, well, you have Stoke-Adam syndrome. MashaAllah. Stoke-Adam in 8 minutes. Many things, you know, many things. Oh, you have leukemia. Guys, you can easily give diagnosis in the form of 2 differential. It's fine. But 2 differential related to the station. Now, she had time. Time did not finish. And she should have at least mentioned 1 word about my concern. My concern was stress. That's a secondary one, but the primary one, the relationship with my partner. I don't want much, but I wanted to tell her, by the way, I had a concern. It's affecting the relationship with my partner. You know what? I was even hoping to tell me at the end one phrase. Let's manage your headache. And as you mentioned to me, that's affecting the relation with your partner. Let's hope that it will be managed and then things will be okay between you and your partner. As simple as this. As simple as I listened to your the relationship with the partner. Guys, are you following me? Yeah. I mean, I drop things here and there to just grab your attention that yes, you can have a station. Yes, a station that you know, but yes, you fail it. Because of missing concerns, missing things, missing active listening, you know, and a bit of talk about work. She had time. Work. Yeah. Why don't you take some time off work? Why don't you take a rest of work? Why don't you apply for an annual leave? Sick leave. You understand? Because she's stressed because of work. Next. Thank you very much. Next is, guys, did you get the hang of relevant? Yeah? Did you get it? Management, talking, two-way conversation, how to give provisional diagnosis. It can be more than one, not just one. Yeah? Next is a station about a patient who is refusing admission and she is diagnosed infective endocarditis. Can we, I don't want to be annoying, but I can open the questions. I don't have an issue, wallahi. But at the same time, by 5, we'll all be tired. 4:30, I will be tired, we'll be tired. Then we're not going to finish as many as I want. You get me? So you can ask on the mentor group, you can ask, we've got the mentor group, the WhatsApp group. But I really didn't want to waste time because I want to give stations, many stations. Well, he's upset for me now, I'm sure. But it's for you guys, wallah. I can be sitting here for all day for questions. Okay? Ask in the mentor group, I'm there. Yeah. So, a patient refusing admission, diagnosed infective endocarditis. Guys, can you hear me?
Yes, doctor.
Yes, sir.
Perfect. So, you must have refusal in the exam. You must. That's not something to negotiate about. You must have a patient who is refusing something. Like what? Like refusing admission. Infective endocarditis patient, and she wants to go home. Like what? What else? Like refusing an advice was given to her. She was diagnosed MI or stroke, and the physiotherapy wants to give her exercise, and she is refusing. Refusing anything. Okay? Guys, this is not medicine station, and you need to understand this. And today I'm here to tell you, no medicine station. This is not medicine station. And I want you to know that one thing, if you don't do, you will fail it. One thing, if you don't do, you will. If you don't assess this patient mental capacity from the start, you will fail. Why? Because the station will be about a patient who is refusing something and it should be done, like admission. He should be admitted, but he wants to go home. Exercise. She should have exercise with the physiotherapist, but she wants to stop it. Yeah? So the thing that they will bring in the exam, a patient who's DKA, refusing admission. Please mute your mic, doctor. Please. Please mute your mic. Please. Now grabbing the attention. That's all. Just grabbing the attention of you. So, Bismillah ar-Rahman ar-Rahim. Does he have capacity or not? But why? Because if he has capacity, he has the right to make his own decision. But I will just negotiate with him. Brother, what do you want? I want to go home, doctor. Why, yeah, brother? Because I have the cat at home. Can anybody look after the cat? Any neighbors? Any? No, doctor. We can bring the RSPCA. You don't need to know the name, yeah? Royal Society of Cruelty. You know, there is a organization specialized in looking after the animals. No, doctor. Do you know what you have? You are assessing now. You are telling him what you have, and you know what you need to be in the hospital for to make sure that he knows. Doctor, I know, but I want to go home. You can go home. can I do? But the other patient, doctor, I want to go home. I don't want to stay admitted. Well, definitely you can let you go home. But I'm sorry to ask you some silly questions, somewhat. Silly. I'm signposting. Silly question, signposting. Do you know why you are in the hospital for? I'm not in the hospital, doctor. I'm in Maldives. Okay, all right, okay. So now you know that the patient started to tell you things that he doesn't have? Mental capacity. So in that case, it doesn't apply. You can go. He can't. No mental capacity. So the examiner wants to know that if you have at any time patient refusing something, first thing you will do, assess his capacity. Mental capacity means, is he with it or not? Which means, does he know about his condition? Yes, he knows. Does he know about the risks of leaving or stopping exercise? Yes, he knows. Does he know about the benefits of doing this exercise? Yes, he knows. Yes, he knows, but he wants to go. Did you try to ask why he doesn't want to exercise? Yes, I did. You get me? Yes, I addressed it, but he wants to go. Can he go? Yes. Guys, you think sometimes I will fail because I did not convince him. No, it's not your job to convince him. All right? So let's do a station. And the station will be all about I want or I don't want this. So you will start by definitely we can help you with that. That's all our starter. Definitely we can help you. Definitely you can go home. Definitely if you don't want to exercise, you must start it like this. But can we have a chat? Yes, doctor. Yes. May I ask why don't you want to exercise? He will give you a reason. The reason could be logic and could be not logic. Try to make sure you work on the reason that he doesn't want or you want. Then after that, no, doctor, you addressed it, he's not happy. Then coming to assessing the capacity. So after addressing the concern of why he is rejecting or accepting, go for capacity. And the capacity means, do you know what you're having? Do you know the condition you're having? Yes, no. Do you know what will happen if you stop exercise? Yes, no. Do you know why we give you exercise? Yes, no. That's capacity. He knows what's going on. And he's refusing. That's it. It's fine. But if you somehow manage to convince him, that's it. But you don't need to convince him to pass the station, as long as you follow the steps. So, Dr. Nuran, okay? Doctor, where are you from? Jordan, okay. Because I like to get every doctor comes out different nationality. And I like to give more to Indian. Like if I'm gonna get one from Pakistan, one from Bangladesh, two from India. Because Indian like 10 times Egypt and 10 times Pakistan, right? So again, it's the percentage. You understand? So no only think about percentage. So after Dr. Nurhan, we need one Indian. We need the Indian doctor to sacrifice one Indian. This is not coming out. Okay? And then a doctor from Pakistan, and then we'll carry on. Okay. 55 years old. 55 years old. Mo Sobhy. And in this scenario, I will tell you the meaning of do not talk about irrelevant stuff. Guys, sometimes in the station, you talk about irrelevant stuff. Let me give you the question, a typical question of the GMC questions, like as it comes, the way it comes. Not from we don't know the questions about the PLAB, but we just like trying to improvise. The way it comes. The question will come, who you are. You are an FY, that's the question, yeah? Who you are? You are an FY2 doctor in the stroke department. Where you are? The stroke department. Who your patient is? Your patient is Mo Sobhy, 55 years old, was admitted 10 days ago with a stroke. Background about the patient, hypertensive, diabetic, and heart failure. Hypertensive, diabetic, and background about the patient. Your task is, that's how the question come. And that's what I want. In PLAB 2 exam, I want you to focus on your task. Your task is, the patient is refusing the physiotherapist to give, to perform, or to, to go ahead with the exercise with him. Talk to him, address his concern. Did you understand the question?
Do you want me to repeat it again?
Absolutely. Did you understand the question?
Yes.
Guys, today, inshallah, we'll cover plenty of stuff related to the exam and how you want to approach it. Yeah? And it's all exam questions. Let's start.
Okay.
8 minutes.
Begin.
Hello, I'm Dr. Nurhana Uzaid, one of the doctors here in stroke department. May I confirm your full name and date of birth?
My name is sobhy, and I'm 55 years old, doctor.
Nice to meet you, Mo.
Nice to meet you, doctor.
I can see from my notes that you have been admitted here for a while.
Yeah, I've been here for 10 days. Yeah.
Can you give me a quick recap about what happened?
Why?
To be able to address your concerns in better, please.
All right, okay. Well, I've been here for 10 days now.
All right.
And I had stroke.
Okay.
And that's it. I was managed and they put me on medications, and yeah, I'm ready to go home now. And yeah.
And how's your condition now?
Yeah, I mean, a bit of weakness, but otherwise, well.
I'm glad you're well, but what about the weakness?
Yeah, I mean, to be honest, like, I have this physiotherapist, annoying physiotherapist, and I mean, she just come all the day and every time in the morning and just want you to do this exercise, but I'm not really happy with it. I don't like it to just,
I'm sorry about what you're feeling, but can you tell me why you're not happy about it?
Well, I don't want, every morning they wake me up in the morning and they want to do exercise. They want me to walk and I don't like walking. I hate walking. And especially the fact that they come in the morning, first thing in the morning, I don't like it. I just don't want exercise. I don't want it.
So you don't want to exercise at all, or you don't want the timing of at the morning?
Well, it's more of like, she comes all the time in the morning. I hate it. I hate coming and waking. Oh my God.
Yeah.
She wakes me up. More. Wake up, more. Wake up. And just like, I don't like to wake up
Sorry
early.
about that. Yeah. How about we can change the time? Will be okay with you?
Well, that would be actually great if we change the time and we change even, the physiotherapist.
The physiotherapist.
As well, yeah. The timing and the hair, because she will be annoyed for me, because she will know I complained about the timing. Because every time she comes in the morning and I tell her I don't want the morning, about, yeah.
Okay, how about I talk to her and get back to you, and I can also bring her to talk to you about that. Will be alright?
Definitely, yes.
Okay,
yes,
that's great.
I don't want it in the morning, please.
Okay, we can definitely manage that. Anything else is bothering you?
No, just the fact that this morning thing, I don't like it.
Okay, we can manage that, as I told you. Okay, so now can we have a chat about your condition?
Yes.
All right, so you mentioned that weakness. In which part in your
The weakness was in my right side.
Right side, in your arm and leg?
No, only my leg.
Your leg. Okay, I'm sorry about that. We can help you with this physiotherapy. Okay, and any problem?
By
with
the way,
speech?
station has finished. This is just all extras. Yes, carry on.
Any problem with talking?
No, talking is fine.
That's good. And can you tell me about your medical history?
Well, I mean, blood pressure, heart failure, diabetes, and I go to the GP for them. I mean, I'm following up.
That's good from you that you're following them up. And how's your high blood pressure managed?
Well, it's on medication and lifestyle, and yeah.
Okay, and
I'm following good lifestyle now.
Is it controlled?
Yeah.
Okay, great. And you take
And I
medication as
take medication
prescribed?
as prescribed for blood pressure and for diabetes as well. Yeah.
Okay, great. And what about your heart failure?
Yeah. It's managed as well. I follow up, and I'm taking everything. Yeah.
Any chest pain recently?
No.
Okay, any heart racing?
No.
All right. And what about your diet or lifestyle?
Well, I eat healthy. I started following a good lifestyle after being diagnosed with these conditions, and yeah.
I'm happy that you are taking the balanced lifestyle. Okay, do you exercise? Are you active?
That's now, you know, I told you earlier that I don't like exercise, so I don't like it. But, you know, I don't do it. Yeah, I don't like it, as I told you. I only do it because of they said it's good for my weakness, but I don't like it.
Yeah, and how about we can manage you with something you can like it to improve your life?
Yeah, of course. How can you manage something I
Okay,
like?
do you like a particular activity? Any hobbies?
Yeah, table tennis.
That's a sort of exercise, actually.
Really?
Yeah.
I thought exercise is just walking and going to the gym and
No,
getting. I
there's
enjoy table tennis,
some
but I
some
thought it's
sort
not
of mild
exercise.
exercises you can do.
Okay, all right.
Okay, so it's good. You can start with the table tennis.
All right,
All
okay.
right.
Okay.
All right. Do you smoke by any chance?
Well, I don't like smoking.
That's good. And what about alcohol?
No. I'm Muslim. I don't drink alcohol.
Okay, I'm happy to hear that. You don't like alcohol. Okay.
You know, if I said I'm Muslim, I don't drink alcohol. You cannot
Okay.
comment on a religion or a, you know.
No, I mean you don't like alcohol, so I'm happy.
Okay.
Okay. All right. So do you have any concerns so far?
No. I'm happy in the hospital. All the nurses are good to me, and they're all
That's
lovely.
good. All
And
right.
everybody's good. Yeah.
Okay, so I can see that your main concern was the timing
Yeah,
of
with the time.
physiotherapy
Yeah.
and the physiotherapist itself, herself. So I can ask my colleague to come and talk to you about that, and we can manage the timing with each other.
All right, doctor.
All right. Do you have any other concerns?
No, thank you.
Okay, so remember
2
my name,
minutes remaining.
Dr. Lahana Huzaid. Whenever you need anything, just ask the nurse to call me.
All right.
All right. Thank you.
12 out of 12. Right. So, and you remember me when you pass your exam? Text me because you'll
Okay.
get inshallah few 12s and 11s. Inshallah.
I hope so.
Inshallah, 100%. Inshallah. So far, I'm happy with the doctors coming out. Seriously, no, it is good. Now, did you see? Did you notice? We know now the approach. I don't want exercise, but I changed it a bit in order to tell you guys in the exam they can do anything. It's fine. It's all leading to the same approach. The same thing. I'm refused. You know, they run out of things now. Now, tomorrow morning, you might find patient refusing. Refusing what? Well, they've asked him, for example, to stop alcohol and he's refusing. Anything. A patient can refuse anything, and it's the same approach. But did you see that the station was solved with a very good natural? Guys, it's all about being yourself. It's all about having a chat. Did you see one question? Hi, I don't want to exercise. And in the talk I said, I've given her the hint, which is active listening, the morning. It's not exercise. Then she stopped and said, well, Mr. Mo, is it that you don't want to exercise at all or the problem with the timing? Then she broke down the station. It is the timing. Then we know now what we're talking about. Do you understand me? Did you feel that she's following any script or did you feel that she's like natural, spontaneous like? Then we started talking about the morning. Okay, I can solve this problem and okay, and this and that. You understand? However, I wanted a bit of extra on this station, just relating the exercise to my weakness. That's it. To help to make the compliance even better. Why? What do you mean? We spoke about the timing, and I was happy with the timing and everything, yeah? But try to somehow, by the way, do you know why we are trying to mobilize you and to make you move and, you know, to help you, to encourage you doing that form of exercise? Do you know why? Well, because you developed weakness. I can see from that you presented stroke and developed weakness, and the only thing is to get the muscle running again and to prevent stiffness and to make sure that, you know, you are mobile and everything, is by doing this form of exercise that will help me with the compliance. Do you get me? It's just relating. Yes, we solved the timing, but she should have extra
benefits and risk.
Yes, tell me the benefits. Why? Why do we want you to exercise? Do you know why? Because you had weakness. And if we don't encourage exercise, then you're gonna have stiffness. You're not gonna be able to mobile freely, and we don't want this for you. We want you to lead normal life. Oh, really? Oh my God! So if I don't exercise, exactly like the patient. For example, similar situation. Am I refusing diet? You see, that's a made question now. Am I refusing? But can you comment the exam? Guys, that's what they do. I mean, anything. It's all the same. Doctor, no station, عادي. How can I, doctor, I don't want to follow this diet that you give me in the hospital. This healthy thing I don't like. Definitely, Mr. Mo, you can eat what you like. That's the approach now. Nobody can force you. Nobody can to eat anything. But just a quick chat. Do you know why we're trying to give you such diet? Well, doctor, I don't know, doctor. Well, Mr. Andrew, you developed MI, right? Heart attack. Yes, it is life-threatening. We don't want you to go through this again because it is life-threatening. So now you are relating my problem that I don't want, the diet, with the condition itself. Don't just go haphazard. No, relate it. Mr. Andrew, we are trying to do that because we care about you. Do you know what MI is? Do you know what heart attack is, Mr. Andrew? No, it is decrease and explain. Do you know what can cause it? No, doc. One of the main things that can cause it is the fact that you don't follow a healthy, and it is life-threatening, Mr. Andrew. That's why we're trying to. So, guys, be natural. Guys, it is counseling. It is how you talk. It is how you convince. So that's the only thing I do not like about this station. I loved everything about it. The station was good, natural, fluent, active listening, to the point, filtering. Morning or all? I mean, is it just the timing? Or, but what I did not like is, why am I having exercise? What will happen if I don't have it? Which is risk and benefit. Do you know why we're giving you exercise? So please, are you lost or seriously? So please, these stations, you don't need to follow a pattern of no, you follow a structure. This patient, I will go, I will ask why do you want, I will try to address the concern of the timing or whatever, and then I will go through the risk and benefit in order to make sure that he's aware of why we're doing this and what is the risks of not doing it. And
Dr. Mo, can I ask something?
I'm sorry, dear. The session
Just
is
related
long.
to
Sorry?
just one point. Just one point. Like
One point
building the
for you.
rapport.
There is two doctors here. They were asking me
Okay,
questions. And,
okay.
guys, when you
I
ask in the
was
group, we answer. Wallah, we answer. I
okay,
do.
okay.
We have many doctors to answer, but I don't want to waste your session. That's all, dear. I don't want to waste your session. And if I listen to one person, I will listen to everybody now. Okay. However, you can ask it. I'm sorry, but just because face-to-face doctor, you can say after the session, I'm sorry. You know what I'm talking about. Online doctor, she can take it from me now, and that's it. This guy is bad. He's the worst ever. So we don't want this impression. What's your question?
Yes, doctor. I was just like one point was that isn't it important to build a rapport first because she directly jumped to
If
why
you,
you are here.
yeah, if you seen her face,
Okay,
fair enough, rapport for me. Did you see her
okay,
face?
okay.
She was smiling from the
No, no.
start. She was
I
smiling from
couldn't
the
see the
start.
face.
She was
All
smiling from
right.
the start. Enough for me. I could feel warm. Hi. When we started the session, she was smiling, like When we started the session, yes, she was smiling. Rapport can be smile, can be the way you start your session. Happy one, not like we're not miserable, So rapport is not rapport. So you know, but yes, you can say, but the rapport could be physically, facial, smile, everything. But rapport is important, yeah. So thank you very much. Dr. Nurhan, one of our soldiers. We will hear good news, inshallah, very soon. Inshallah. Okay. So, guys, refusal. refusal, no scripts, no dialogue. It is, let's have a chat. Why don't you want to this? Okay. Do you know why we're having it? Do you know why you need it? Yeah. And try to work on the patient to concern. If he doesn't want something, he must have a reason. A reason. Then you as a doctor weigh everything. Okay. I will give you just a quick chat about the patient who's refusing admission infective endocarditis. Okay? Same approach, yeah? Hi, doctor, I want to go home. I don't want to stay here in the hospital. But in the question, it is written that the patient has. So, guys, whenever they write in the question, the patient has something, you don't need to ask about the history and why you are in the hospital for infective endocarditis, doctor. Did you have a chest pain? Yes, doctor, it was here. Where did it go? No. They gave you this to save your time. Diagnosed. You don't need to do anything about it. So please, the finding in the question is for you not to. Sorry? You don't need to ask how did it diagnose no. The patient is diagnosed the infective endocarditis. The station is he wants to go, speak to him. She wants to go, speak. That's the station. The station is not infective endo. The station is not why she's having infective endocarditis. The station is management to infective endocarditis. No. The station he wants to go home, talk to him. Do you understand my point? However, after you do your job, خلاص, he's gonna stay in the hospital. We agreed. Then do whatever you want. Then talk to me about the hospital stay. Then whatever, anything. But after you do your job, I told you when I said her job is finished. That's all extra. So infective endocarditis. Doctor, I want to go home. Same approach. Definitely. Guys, if a patient wants or doesn't want something, start with giving him the power. Why? Because if you give the patient the power, trust me, the fact that I know that, yes, you can go, I will be easy with you. But from the start, well, that's how people do, and they don't realize. Doctor, I want to go home. Well, can we have some question first? So is it depending on the question, doctor, or what? You gave me, guys. But the approach, definitely you can go home. But can we have a chat? So now he knows, definitely I can go. Now he is relieved. Then let's have a chat. But no, doctor, I want to go home. Why? Don't ask why. Like, no, you cannot. Why? Is it depending on my answer, doctor? No, I will understand it like this. If I tell you, you ask me, you spoke to doctor, I want to go home. Why? This now is, you know that he's got the power. Why? Why do you not go home? No. It's not your business why. That's as a patient. It's not your business why I want to go. I want to go home. Definitely you can go. It's your decision. Nobody can keep you by force, but can we have a chat? Yes, doc. May I ask why do you want to go? That's the approach, not just why right away. Clear? Okay. Clear, guys? However, there is another station. I'm trying to now do like brainstorming now, yeah? Here and there. Ask me, how can I help you?
How can I help you?
Doctor, I want to change a counselor.
Definitely we can change.
That's what I want. Definitely. Don't say, why do you want to change a counselor? Guys, I have the right to change a counselor without a reason. Do you understand what I'm saying? Yeah. Definitely you have the right to change your counselor. No problem with that. But may I ask why? Anyway, so my point is that we're going back to again. So infective endocarditis. Doctor, I want to go home. Nobody can keep the patient by force. What was I saying last before this example? I was saying something. What were we talking about exactly? There's a point I wanted to. Anyway, so I want to go home. Infective endocarditis. Why? No, definitely you can go home. But can we have a chat? May I know why? Then the station will start. The patient will give you a concern. In the infective endocarditis station, doctor, I want to go because I cannot stay in the hospital because I want to go for a smoke and do not allow me. Don't forget, same. Definitely you can. Do you wanna assess knowledge? Yes, you need to ask. Do you know what you have? Do you know why you are in there? Do you know what will happen if you go home? Why you are in the hospital? Doctor, I have infective endocarditis. Do you know what infective endocarditis is? Yes, doctor, it's this and that. Do you know why we keep you in the hospital? Yes, doctor, because I need to take medication through my vein, but give it to me tablets. Well, I totally understand where you're coming from. I can see where you're coming from, but I'm afraid medication should be through your veins. Doctor, but I want to go to the outside because I want to smoke and they are not allowing me to smoke. So what is the patient main concern here? Smoke. Okay. Now, as a doctor now, yeah? The patient wants to go because he wants to smoke. And you want to keep the patient in the hospital, but he has the right to leave for a smoke. He has the right, to leave, to go home. Would you let the patient go home just because you're not going to allow him to smoke and die? Or would you try to find a solution and negotiation? And you get me or not? It came to an end now. Doctor, if you don't allow me to go outside and smoke, I will leave. Do you know what you have? I know what I have. Do you know what? I will leave if you don't allow me to smoke. Would you really say, well, you can't smoke, so you can go and he will die? Would you do that?
No.
So guys, you need to understand this. So I can bring you any example. I'm here not to make you aware of one scenario. I'm here to tell you, you will need at this time to reach a middle in between you and him. So now you can give him, number one, well, Mr. Andrew, plenty of things, plenty of solutions we can do here in regards to smoking. We can give you nicotine patch, we can give you some tablets. No, doctor, I tried them, they are not working for. So what is my first option? Is medication. No, doctor, it's not working for me. I want to go, doctor. No, I need my cigarette. Doctor, I enjoy my nicotine, doctor. Nicotine. I don't like these batches you put. That's why the patient said, I need nicotine, doctor. Okay. Well, Mr. Andrew, the hospital is not a smoking area. You cannot smoke in the inside the premises. Doctor, but I'll go home then. Well, Mr. Andrew, we care about you. Now I'm giving you that we are not coming to a solution, but I'm trying to. Yes. Well, Mr. Andrew, if the fact that you need to smoke will make you stay in the hospital because we know it is life-threatening, because we already agreed, me and him, on the life-threatening and the rest. Yeah, now we are coming to medication, patches, nothing. Well, I can go and talk to the nurses and the nurse manager. So you can go and smoke outside the hospital, but supervised, because we care about you. We cannot let you go outside the hospital without any supervision. Would that be all right with you? Because we care about you. You might collapse, you might, So supervised. Yes, doctor, I'm happy now. Supervised. Talk to them. I will talk to the nurse manager and we can, reach something like this. However, now we agreed or not? Agreed. Now we finished? Yeah. However, do you know the effect of smoking? It's not a smoking cessation clinic, but you need to. It is a smoking versus, do you know what smoking can cause? Smoking is very bad for your health. Smoking affects the heart, wound healings, and you can discuss a bit about smoking. For now, we agreed for future, for him to give it a thought. Think about it. Many things we can help you with to stop smoking. Give it a thought. When you're ready, we can talk about it and end the station. Why? Because the station, he wants to smoke. And now he's not in a position of smoking cessation. So we agreed, supervised, yes, you can go. The hospital is not smoking area, but you can go, yes, at the end of it. But throw the ball in his area now. Look, we can help you many things because smoking is very bad for your health, for your heart. But give it a thought. When you're ready, we are ready to discuss it. Always with the patient, do not force anything on him. The patient should not be forced on anything. The patient is always okay. Clear, guys. Yeah. Guys, please, these stations are not a script. It's just conversation, chat. If you make it that way, you will get a very good mark, very high mark. Chat. Okay, third, we need a doctor. India, Kerala in India, yeah? South or north or? Huh?
There is an Indian.
Come, brother. We're looking for, yeah?
Sacrifice.
Yes, sacrifice. Okay, guys, so far, the doctors I've seen, I'm really happy, seriously. So far, we are doing a good job here, okay? Dr. Khalid just woke up now, just arrived. Clap to Dr. Khalid. Clap to Dr. Khalid, just woke up now. Yeah, let's start.
Do you want me to
Now, sorry? No. Now, we will talk about online doctors. Is everybody doing good?
Yes.
Yes,
Yes.
doctor.
April doctors, I'm sure you are getting plenty of stuff, but don't worry, it's all coming in the course later. خد فكرة واشتري بكرة. Don't worry, everything is coming later in the course. That's a very good recap of PLAB 2 as a whole. Okay, now we'll talk about a topic that is a must in the exam. A topic that is a must in the exam. Minimum 2 stations. And you can find more. What is this? It is a patient who's coming with a test result. A patient who's coming with what?
Test result.
Test result. The test result can be blood result. The test result can be biopsy. The test result can be CT scan. The test result can be many things. A patient is coming with test result. Can be urine test. They can bring any station in PLAB 2, guys. We need to know the concept and apply it on a station and see any test result. Okay. What are the mistakes that we do make in these stations? What goes wrong here? What goes wrong? That you start asking about the condition itself. The patient came, the blood result was done, the patient was diagnosed something. For example, a patient presented, that's the question, yeah? That's the stem. A patient presented a week ago to the hospital, to the GP clinic, with tiredness. With what? Blood result, or blood was taken. The patient is coming today for the blood result. For what? Blood. In the cubicle and in the stem, they given you hemoglobin and the iron studies. Talk to the patient to address his concern. Did you understand the question? Online doctors, did you understand the question? It's like I'm
Yes.
saying, yeah, online doctors.
Yes, doctor.
Yes, sir.
Okay. One thing you don't do
Again,
in this
doctor, please.
station, you do not start the station with how can I help you? You don't. This station is not how can I help you station. Wallahi, 1 or 2 stations test result in the exam. I don't care what test result. The station will not start with how can I help you. No, it's a follow up. I can see from my note that you presented a week ago with tiredness. And I have your result here with you. This is the start. Not how can I help you station. Okay. What else you want to say? So it's not how can I help you? It's a follow up. Because if you say how can I help you, what will the patient do? He will assess your mental capacity. Seriously, I mean, he will assess your cognition. Doctor, do you know where you are? Doctor, do you know who brought you here? You know, like, it's not how can I, it's a bad start. Number two, the station will be about 3 words. Write down the 3 words. This is the station. 3 words. Can you give him his pen and paper? Yeah, he's looking at them. He's looking at them, you know. Good doctor is a good observer. I observed. You need. The station is 3 words. Explain the result. What did I say?
Explain the result.
Guys, it's not a case of like when we had your blood and they chose anemia. No. Explain the 1/3 of the station. Explain. We have your blood test here. We have something called hemoglobin. It's the component in the blood. It is decreased. The values are low. We also have the size of the cell, of the blood cell. It is low. You understand? Explain the result in a simple way. Don't say to him, well, we have MCV and MCHC. No, it is the blood size, the color of the blood, the hemoglobin levels. That's how you explain it. Yeah. What is the first word?
Explain the
The
result.
second word, ask about risk factors. What? Risk factors of what?
The condition.
Of anemia that you have already. You have already anemia. Dr. Mo. So this is not a case of when did you feel tired? Doctor, 3 months ago. How did it happen? Doctor, it happened all of a sudden. Okay. And is it increase? It is increasing, doctor. So how is your diet? Tiredness, A, B, C, D, E, TB, cancer, diabetes. No, it's not. It is diagnosed. I just want to know the cause of the anemia. So just the risk factor. Is it because of diet? Is it because of malabsorption? Is it because of bleeding? In details. Diet in details. Malabsorption in details. Bleeding anywhere in detail. Are you following me? Yeah. So it's not a history taking. How is it affecting your life? You've been tired for 4 months. Ya Ragel, 4 months, that sounds so. No. Your colleague has done it in the first consultation. You understand? It's been done. Here, it is why is it happening? Because I have the result with me. Are you following me? But that doesn't mean that if I ask psychosocial is wrong. But I'm saying to you, explain the result, why this is happening, and the third word is management. That's it. The third word is guys. This is the station. But what comes first? What comes first? Is it explaining the result first, or the risk factor first? No, whatever the patient wants. Well, Mr. Andrew, I can see from my note that are coming for follow-up. Yes. And you had tiredness and blood result was done. I have the blood result with me here. Would you like me to discuss the result first, or should we have a chat to get to the bottom of what's happening? Doctor, let's have a chat. Doctor, let's have chat. So now we're gonna start with 1 or 2? The second, the risk factor. The risk factor, yeah? So Mr. Andrew, tiredness can be caused. Now I'm signposting because I'm not gonna say, doctor, let's have a chat. Look at that. Doctor, let's have a chat. So the patient is ready for you to take history about that risk factor. I'm not going to say, how's your diet? No, that's signpost. Mr. Andrew, the condition that we're dealing with now can be caused by many things. Anemia can be caused by many things. One of them is diet, can be caused by if the patient is having any problem in his tummy or any bleeding. So can we have a chat to go to the bottom of this, then start asking about the diet? So now the patient, when you're asking him, does he know why you're asking him? Does he know why you're asking these questions? Yes, he knows. Signpost, God. Look, I'll give you example. The only example is for you to know. Mr. Andrew, I can see from my note that you are coming for your blood result. Yes, doctor. Would you like me to explain the result first, or should we have a chat? Doctor, you can have a chat. How is your diet? Why are you asking about diet? Because it's the reason why you might be. So signpost. Yeah, we'll ask you some questions to go to the bottom of what's happening. To go to the bottom of why you are having this tiredness. Is that all right? Yes, doctor. Can you walk me and then? But you can talk or ask about tiredness if you want to ask only tiredness, not causes, not differential. So if you want to start it with, can we have a chat? Yes, doctor. You've been feeling tired for how long? How did it happen? You understand? But nothing else. So if you want to start it with history, you only need the complaint and then the causes, not differential. Are you following me? Yes. So again, only complaint and causes, not differential. No differential, only complaint and causes. Okay? However, when you ask about the causes, you could include in the middle when you're asking about the cause of anemia. Yes, you can include family history, cause family history of anemia. You can include medical condition of any blood disorder, but it's all considered as causes, not differential. I hope you're not lost, because that's an important issue for me. you always take. Have you finished the first batch? Yeah. Because you always take long history in blood result station or test result. Okay. So let's do a station, and I don't want history. I need risk factors. You understand? Even when you ask about medical condition, it is considered as cause, not differential. Clear? Okay. If a patient is 80 years old, 85 years old, 89 years old, blood result in the cubicle, iron deficiency anemia. Iron deficiency anemia. Talk to the patient. So you need to explain result, you need to take history about risk factor, you need to manage. But in the history about the risk factor, do you want to ask cancer? Yes. Because it can be a cause for anemia. I just want to make you aware. I ask risk factors, but sometimes there are risk factors apart from outside the box. We know that anemia 1, 2, 3 causes, but cancer could be. So make sure cancer is a cause in this case. Are you following me? So don't ask differentials. That's my point now. You can ask medical condition as a cause. You can ask, are you on any medication as a cause? Because maybe some medication causing anemia, but you don't ask differential. So let's start. I'll give you an easy case. Okay? But this case, it will be quite mixed. I will tell you now why mixed. When you explain the result, is it Mickey Mouse explanation or slowly? Slowly, guys. It's 1/3 of the one. How many words we have? 3. One of them is. So it's not a. I've done blood test and it's shown anemia. No. Whatever there, explain. And that goes with the station as well. Hypo or hyperthyroidism. If you have a result in the question of thyroid function test, yeah, and it's showing the gland is hyperactive, talk to the female. And that's your concern. She's 22 years old. For example, make sure my structure is 3. I need to explain. I need to find that. And then when you explain the result, it's not we have your blood test and the thyroid function is low. No. That's why I said it's 1/3. It's what? 1/3. 1/3 of the mark. When we have a gland in front of our neck, it's called the thyroid gland. It is butterfly gland. This gland is responsible for the body function. The body function. From the result I have, it seems that your gland is hyperactive. So your body is speeding up. Guys, do you understand me? Yeah. That's the way you will explain result. Not you have hypothyroidism, you have hyper, let's talk about it. No, it is that's why they tell you, yes, we don't want to differentiate. Yes, we don't want, but you still will finish in 8 minutes. Why? Because you will explain the result in details in a simple way. Let's start. 25 years old, Ashwarya Roy, presented today for her swab result. For what? Swab was taken and shows gonorrhea. Swab showed gonorrhea. Is that test result or medicine station? Test result, guys. Guys, today I want to drill in your head test result, no differential. Swab shows gonorrhea. Talk to Ashwarya. What's happening? You need to talk to Ashwarya. Yeah. We are online. Online, okay. Talk to Ashwarya and address your concerns. Clear? Guys, are you tired? I am myself. I will feel tired after the session, but because I'm done talking, I'm not tired. But are you bored? No. You all have exams soon. You all have exam 2 days, 3 days. At any time, you feel that I know this. That's all. It happens. Just leave. I don't feel offended. Just go, because at the end of the day, I need you. I need what you want. It's not what I want. Yeah. So you're not tied here till the end. Okay. Okay. So now let's see what goes wrong in the station, and let's apply in order to have time to manage the station. Okay? All right. You know, I always feel happy when I see the head is moving that way. Seriously, seriously. I'm serious. I'm not serious. It means acceptance.
Dr. Mo,
People are happy
Dr.
with
Mo,
what you are saying. Yes,
we always feel happy when we see you.
brother. Wallahi. What more do you want? What more do you want in life? I don't want anything in life. That's it. You feeling happy? Yes. Okay, let's start. Ashwaria, 25 years old, presented. She had swab was taken and shows gonorrhea. Talk to her, address her concern. Relevant. Explain result. Manager.
Begin. Hello, I'm Dr. Dayan. I work as a junior doctor in this department. Can I please confirm your name and age, please?
My name is Ashwaria Roy, and I'm 25 years old, doctor.
Okay, and how may I call you?
You can call me Ashi.
Okay, Ashi. So I have your test results here. I see that you came here 1 week ago,
How do you know 1 week ago, doctor?
I can see it from my notes.
Okay, we're gonna start the station again, okay?
Okay.
I did not mention any week.
Oh,
I did not
all
mention
right.
time. Okay, right? Why did I stop him? Because I don't like this. If it's not mentioned, don't make things up, please, guys, because that's what happened. You know, I'm sorry. What happened is in the question, it's not written something, and then you mention it because you read it somewhere. Don't just. I can see from my note. No week ago, not okay. Maybe because you did not read the question, so you forgot. So just swab was taken, showed gonorrhea, and that's it. Okay.
Begin. Hello, I'm Dr. Dayan. I work as a junior doctor in this department. Can I please confirm your name and age?
My name is Ashwaria Roy. You can call me Ashi.
Okay.
And I'm 25 years old, doctor.
Okay, Ashi. So I have your test results here. And before we discuss it, would you like to have some chat so that I can put myself in a better position to explain you?
No, doctor, please tell me what's going on with my result, doctor. I'm really worried about it. Actually, since the swab was taken, I'm just stressed out. I just want to know what's happening, doctor. Is my boyfriend cheating on me, doctor?
Oh, Ashwarya, I see your concern. I'll be helping you with that. It's okay. I'll tell you the results. All right. Ashwarya, I have your results, and it shows that you have an infection. It's called gonorrhea. Do you know anything about it?
No, doctor. Infection where in my ears or my nose? What about, doctor?
Well, as you know, the swab was taken from your vagina.
Okay.
So,
all right. Yes.
yeah.
Yes.
So it is an infection of your vaginal passage.
All right. Okay.
I see, Ashi, you are quite concerned about this.
I just like one thing. I didn't want to. Is my boyfriend cheating on me? Is he the one caused this, doctor?
I see, Ashi, you are concerned about it. I can put myself in a better position if I would like to, if you would answer a few questions for me.
All right, doctor.
Okay. All right. So, as I mentioned, you have a condition called gonorrhea.
Yes. Yes.
Okay. So, it is an infection of your vaginal passage, as I told you before.
All right, doctor.
It's caused by a bug.
Okay.
And I'm afraid to say that yes, it is transmitted due to sexual intercourse. Okay, it's transmitted sexually.
Okay.
All right. So, few questions about your women's health and about your partners. Okay.
All right, doctor.
All right. So, can you please tell me, do you have a stable partner?
Well, I do have a stable partner. I mean, I've been with him for about 6 weeks now.
6 weeks.
Yes.
All right. And you had other partners before him?
Yeah. I had. I'm with Thompson now. 6 weeks ago now. I was with Andrew before him. It's his best friend. We were together for about 3 months.
Okay. All right. Okay. And usually, some people use some toys to simulate themselves. Okay. By any chance, do you happen to use that?
No, doctor. Thompson is good. Andrew is good. I don't use toys.
That's all right. So, Ashi, as you mentioned to me that you were concerned about your boyfriend cheating on you.
Yes, I'm very worried, doctor, about
Okay, so it's a very difficult question for me to answer. Okay, but for now, I'd like to tell you that this bug can be caused by sexual transmission, as I've already mentioned.
Yes.
And it can stay in your body without causing any symptoms.
Yes.
All right. Well, I would like to ask you, why did you come here in the first place?
Well, because I had discharge from my front passage, doctor,
Right.
and
Okay.
It was offensive. It was like, all the time I change my underwear, I see the discharge, and I was not happy with. At first, I thought it's something called bacteriovaginosis, because I know that some discharge can be caused by other things, like, because usually I use soap in my bath and things, but then when it was like, different from that kind of discharge, I came, but I thought it's Thompson cheating on me, doctor, and just he told me it's just sexual transmitted infection. So.
All right. Okay. Yes. So I'm afraid to say that it is transmitted sexually, actually. Sam, one thing I'd like to mention is I would like your partners to visit, okay, so they can be tested for it.
Andrew and Thompson.
Well, are you comfortable informing them?
Yeah, I can. They are best friends and we know each other, so I can tell
All right. Okay. So would you like to know what we are going to do now?
Yes, please, doctor.
Okay. So I would be having a chat with my senior. Okay.
Yes.
And we'll give you medications for this condition.
Yes.
Okay. You will be given antibiotics.
Yes.
All right. And we will be referring you to a sexual health clinic.
Okay.
All right. And you can have your partner visit a sexual health clinic and get themselves tested.
All right, doctor. Okay.
All right.
Okay.
Well, in the meantime, would you like to know what you can do for this condition?
Please, doctor. Please.
All right. Well, for now, I would highly advise you to avoid sexual activity.
Okay.
All right.
I can do that.
And do you practice safe sex?
Well, I don't like condoms. I don't like this feeling of condoms. I don't like it.
May I ask why?
I don't like it. I
Okay.
don't like condoms.
All right. Well, I would still advise you to.
I don't. Always before any sexual intercourse, I tell my partner no condoms.
Okay. All right. Then I would advise you to avoid sexual intercourse, because it's possible that you may give this infection to somebody else.
Okay.
All right. And I would also advise you to not have sexual intercourse with your partners, because it can cause reinfection if they are infected too.
All right.
Am I making sense?
Yes,
actually?
doctor. Yes.
Okay. Do you have any concerns?
No, doctor. No.
All right. Any other questions for me?
No, doctor. No. So, do you think it's Andrew or Thompson? Which one?
Well, it's a very difficult question for me to ask, for me to answer. All right. But you can get your partners tested. Okay. And we cannot really be sure how did you get. But I can tell you that it's a sexually transmitted infection.
All right, doctor. Okay.
Okay. Well, I would advise you to practice safe sex. Okay. That way you can protect yourself from infections like 2 minutes remaining. Okay. In the future.
Okay.
Do you have any other questions, Ashi?
No, doctor. No. Okay. Thank you. Good. What do you think? Well, he missed the questions.
Yeah.
Plenty of questions. Okay. He missed plenty of questions. However, I will pass him the station. Why? Guys, he was calm, nice, signposting, chilled, confident, everything. I don't know, you felt it, I'm sure. Yeah. You felt the guy was cool, like, like talking. And he was not, when I asked him, he was not like, who's that? Or is it Andrew? I'm not really in a position of telling you who, So he was calm, confident. That's why we say if you go to the exam like this, chill, relax, calm, you will 90% the chance you will pass. Even if you don't ask all the questions. People who score 12 out of 12, do you think they asked everything in the world? No. But active listening, main concern, like cool, calm, looking after the patient, addressing the patient concern. So it doesn't mean that you need 12 out of 12. You need to ask all the questions in the world. No. So good. I'm sorry that Ashi was like, was asking me, who's that? Who's he? Who's Thompson? Who's Andrew? Is it Thompson? Is it Andrew? Yeah. But yes.
Thank you.
Guys, he started his station very good, very nice. He said, infection or bugs in the vaginal passage. So basically, he described it as simple. It's an infection, right? Yeah. So now, how many words in the station? We know now, guys. I give you an example of iron deficiency anemia, and then I give him different station to just make you, as much as we can. So the station, I said any test result station. Any test result station. How many words? 3. I need to explain the result. I need to ask about the risk factors and management. That's it. So now I said to him, no, I want to know what is the result. Did he hesitate?
No,
Right? Definitely. He started. Yes, we've done a swab. And it's showing a certain swab infection where in my ears I am telling him, tell me infection in this area. You remember when I said in provisional diagnosis, you need to say the system. Where is the infection? So infection where? So infection in the front passage or in the vaginal passage. And now we're trying to get, and he signposted in order to get to the causes. Can we have a chat? So he explained the result. So which 1/3? 1/3 of the station. Then he started digging for the risk factors. But in the risk factors, he did not really ask the questions enough. Okay, a patient, a female, is having discharge from the front passage. What can cause it? What is the history that you want? Sexual history before the toys. Sexual history, details or 1-2 questions? Detailed sexual history, number 1. What else does he want in this station? Okay, IV drug, but more important than IV drug, P4. P4, guys. P4. P4, why? Is she pregnant? This lady is having STI. Is she pregnant? Am I making any sense? So P4, sexual history, and partner. Write down, and partner. So P4, sexual history, partner. Partner in details or partner quickly? Guys, in detail. I said to him, Andrew, 6 weeks. Thompson, 3 months. You need sexual history for 6 months. And you need to say, is Thompson having any symptoms?
Yeah.
Because he did not even ask about the partner, is he having any symptoms? So, what are the questions that I will ask as risk factors? Or as a history part? Number 1, I need to sexual details, or are you sexually active? Yes, no. Do you have a stable partner? Yes, no. Any other partner? Do you practice safe sex? By that I mean, do you use condoms? Yes, no. So please, detailed. And because I give him only 4-month boyfriends, and I said stable for 6 weeks. So 6 weeks for me is stable. So that gives you the hint that, okay, it's 3 months. And what about that before that? Okay, so we said sexual history in details. P4, partner. Why P4? Guys, he missed P4. Guys, I am having unprotected sex. I'm having unprotected sex. I'm having STI, so unprotected sex. And he doesn't know if I'm in contraception or not. Apart from condom, do I take the pill or not? Because I could be pregnant. Maybe I don't even know. Do you understand me? Yes. Are you convinced? Yeah. So, sexual history in details, P4 in details, and what else? Partner. And when I say partner, for how long have you been together? Does he have any symptoms? Partner. And the rest. Medical condition, medication, allergy. خلاص. Station is confined to why is the STI happening? Is a partner, P4, toys, and that's it. You see? Not like, how's your diet? Do you do any form of exercise? It's not. Clear, guys? Okay. Now, I need to manage. And because I talk relevant history, I have time to manage. Did you notice he has time? He has time. So in management, oh, sorry. There is a very, 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 very important question in history he should ask. In this patient, have you been tested for STI? Have you had any STIs for STI screening before? Have you had any STI previously? Have you had any? Because that kind of patient, with the history she's giving me, is giving me hint. She doesn't like Condoms.
Multiple partners.
6 weeks is stable for her. So you need to ask, have you previously been tested for full STI screening, and have you been diagnosed with any sexual transmitted infection before?
Do we need to reflect about bacterial vaginosis?
Oh, no. I was just giving him a hint, like, no. So the question diagnosed done. So in management, write down, guys. Write down important words in management. Write down at the management when you manage any STI. When you manage any STI, don't forget the patient, the partner. The patient, the partner. So 2 words, patient and partner. And don't forget further. So patient, partner, further. What do you mean? Patient, you need to manage now. Antibiotics. Yeah? Partner, bring the partner to be tested and managed. What about further? Further, condoms. Further, avoid sex until you are treated. Further, STI screening on the change of any partner. So again, what is the management here? How many words? 3 words. Patient, partner. What is the meaning of further? What do I mean by further? Further is how to prevent this from happening further. By avoid unprotected sex, use condoms all the time. By the second one, in further, avoid sex until you're treated. And finally, STI screening on the change of every partner to make sure that things are okay. Guys, are you lost?
No.
By the way, when I give relevant, because I know this is how to be relevant. When I say patient, partner, further, because I know when you are sitting here, so I always like, okay, patient, partner, further. Patient, antibiotic to fight this and this and this. Partner, bring the partner, will be tested, and further. We don't want her to have this again. So for the future, please make sure you avoid unprotected sex. Make sure you use, like, so always when you divide, when you plan your head, trust me, you don't miss anything. When you tell, like for me, in this station, I will say, explain the result. Number 2, risk factor, detailed sexual history. P4, partner and previous STI or screening. Manage 3, patient, partner, further. Further is what we say, what should I do in the future? And then add anything you want. Add other spices, everything has his own things to add, but don't deviate from the main. So in this station, we mixed the test result and at the same time sexual history manifestation, because it's a must in the exam. Sexual history, female gynecology, sexual. 2 stations. 2 stations must. 2 stations are a must. How are you, brother? How's everything? Nice, chilled, relaxed, huh? Huh? Sitting كده in the shade and no light in your face, huh? Okay. Yes. That's so funny, this guy. I swear to God, he's so funny. I swear, I love you. But brother love, yeah? If I'm saying to okay, in Egypt, if you say to your friend in Egypt, I love you. But I love you here, we have to assess knowledge and sorry? Yeah, I mean, I love you as a brother. He knows what I'm talking about. So 2 stations, you cannot have any PLAB 2 exam without them. You can't. STI case, contraception case. And when I say contraception, I mean anything. Long term, doctor emergency, doctor, 2 stations. STI case, and when I say STI case, gonorrhea, like this one, HIV, syphilis, you can't. You cannot pass through PLAB 2 without. STI case, a station about contraception. You can't. 2 topics you must read nicely and you must absorb them well. And the contraception could be long term, doctor IUD, doctor I need emergency contraception, doctor, you know. So next, let's open the list. Okay, next station is a station that will give you a clear idea in phone consultation. In what? Phone consultation. A mistake that we make in phone consultations, and a word that sometimes must be mentioned to change the whole station. Okay? Because when you mention it, it clears many doubts and it really affects your outcome in the station. Even if you mess the station up, there are things that you must mention. Okay. Pakistan, you together, the Pakistani community, the Pakistani society, they can say, okay, we are sacrificing this doctor. Everybody's waving at one doctor. Come out. Okay? Look, everyone next to you said hair. Okay. This is a phone consultation. Okay? This is a phone consultation. So how can we do it to be the best as a phone consultation? Via phone. Sorry? Via phone. Via phone, but she will have to go to another room and then we're gonna have to put this in loudspeaker. Okay. Obviously, if we are face to face, you will not imagine that's a phone, right? Sorry? Okay, perfect. Sometimes he is smart guy. This guy is the barrier, blood-brain barrier. Yes. Well done. Seriously, it's good. Where are you from? Iraq. You remind me of Italy. Italy? No, you remind me of no, an Egyptian series, Kalapsh. You've seen it? No, I've not. Watch it. Okay. Write Kalapsh. Kalapsh, Amir Karara. Just write it down. Can you see, guys? Yeah. Amir Karara, sir, friends. Okay, let's start. Sit down, and now you cannot see me. Okay, online doctors. Do you want to see me? Do you want to see the doctor? You can see the doctor. Okay.
Yes, sir. You can see. Very nice.
Sorry?
See you, sir.
She is the doctor. She is the one, that will, yeah. Anyway, so let's start.
So we'll focus on phone consultation or the topic itself?
It's a phone and topic, because I will apply both, yeah? I will apply phone and topic. It's together, yeah? Like the last station was STI and blood result. So any STI, sexual history, P4, partner, further, no, further. STI screening, previous, which is past history of STI and past history of STI screening. Guys, Wallah al-Azim. Wallahi. Don't be sophisticated. In the exam, you are a different person. In the exam, under exam conditions, you are stressed, you are nervous, you are anxious. That's why, Dr. Sameh, if you have bullet point in your head to cover, if you remember the point, if you remember the word partner, خلاص. Talk to me about your partners, for how long you've been together, does he have any symptoms? So if you remember the word, further STI screening when change the partner, further always condoms, avoid, further, what should she do further? So if you remember the word, it will bring you the whole topic, not try to remember no. When I was studying for PLAB 2, every station on the top of every station, 5-6 words. 5-6 words. I must remember them. And the rest, just will come. But these words relevant. Okay, let's start.
Yeah.
So it's a phone consultation. You have been asked to speak to. We need any Pakistani famous actors. He will tell you. Any Pakistani famous actress, but good looking one. Huh?
Mahira Khan.
Mahira?
Khan.
Mahira Khan.
Yeah.
Okay, you've been asked to speak to Mahira Khan. Yes. Sorry?
You won't sound like Mahira.
I won't. I will try to sound like Mahira Khan on the phone. So Mahira Khan, she's the mother of Adam Khan. Same surname, yeah? Adam Khan. She is calling the doctor because she's concerned. She has a concern. So Mahira Khan, okay? Let's start.
So she's calling me?
She's calling you,
Okay.
okay? But always, guys in UK, it's a good question. A phone consultation, it's not, hi, I need a doctor. Here you go. No. A phone consultation, hi, I want a doctor. So they triage over the phone. Why? My son has 1, 2, 3, 4. Has 1, 2, 3, 4. Depending on 1, 2, 3, 4, either within half an hour you get a call from a doctor, GP, or within 6 hours you get a call. What, depending on what? The triage. So if it's a high phone consultation, my dad, what, chest pain, 65 years old, within half an hour you'll get a call from the GP. Okay. My dad, what? He's not really happy. He woke up in the morning really unwell. He's not really himself. 6 hours. Yeah. So the triage is filtering, but always it will be the doctor calling because you called. Do you understand the mechanism?
Yeah.
Really or not? So it's not, hi, I want to speak to the doctor. Doctor, here you go. It's not. Understand? It's not. It's a triage, and then so always you've been asked to call me. I'm doctor and start. Okay?
Okay.
Yes. Okay. Online doctors, are you following?
Yes, Dr. Mo.
I hope that April doctors, we have April here that they started 5 minutes ago, 6 o'clock in the morning. They started the course, and now they're going for revision. I hope you don't hate me. Oh my God, what are you talking about? All this, but this is all PLAB 2, yeah. So let's start. Yeah. Mahira Khan, she's ringing. Yeah. 1 second. I wanna give you an address.
Yes. Okay.
Any easy address. Write it down. Liverpool, Prescott Road, Anfield. That's the address. Okay?
Yeah.
And Mahira Khan, Adam Khan. Does she have kids, Mahira Khan? No?
Age of the son?
19 months. 18 months. Yeah.
Okay.
Let's start.
Yeah.
Guys, very important things will be mentioned in this station. Very important. It's a pass or fail. It is life threatening in the station. Okay? Let's start.
Hello.
Hello, doctor. Hello.
I'm Dr. Fazil Matlu, one of the doctors calling from the hospital.
Hello, Dr. Ghazal. How are you?
I'm good. Thank you for asking. Am I talking to Mahira Khan?
Yes, doctor. It's me, doctor. Yes.
Okay. Mahira Khan, I can see from my notes that you wanted to make a call for your son. Is that
yes,
right?
Doctor. Yes.
Okay.
Yes, doctor.
Okay. Maya, before we proceed on, I need to ask the whole name and age of your son.
My son is Adam Khan, doctor, and he's 18-month-old.
I see. And can you confirm the address?
Dr. Liverpool, Anfield, Prescott Road.
Okay. Mahira, you sound very anxious. Is everything okay?
Doctor, my son, like, he's short of breath. He's not breathing well. I've just realized, like, I mean, in the morning today, when I woke him up in the morning, I was feeding him. I breastfeed him still, and he was not really, feeding normally, and he was just short of breath, and he's not breathing well, and his color is not normal, doctor, to me.
Mahira, first of all, I need you to calm down. I'm definitely here to help you, and we will be trying our best to help you. Okay?
All right, doctor.
Okay. I just need to ask few questions so that I can have a better idea that what's going on with your son.
Yes, doctor, you can, yeah.
Okay. So you told me it all happened in the morning, and he's having difficulty in breathing.
Yes, doctor, he's not breathing well, doctor.
Was he okay before that?
Yeah, doctor, I want to put him in bed last night. He was all right. He was not really himself last night, but he was not like this.
Can you tell me more about the shortness of breath?
Doctor is not breathing, doctor, well. I can see that his chest and his tummy is just, you know, different shapes and just up and down, and it's just doesn't look right to me.
And what about the color?
He's just not himself, doctor. He's just, his color is turning like, you know, don't know how to explain it, bluish. I don't know how to explain it, but it's not himself, doctor.
And does he feel floppy to you?
I don't really know.
Okay, and he's not taking the feed, right, Myra?
Since the morning, doctor, he's you know, he's not feeding well because it's like he cannot breathe and feed at the same time.
Myra, the things you are telling me that concerns me, and before we can complete our conversation, first of all, I will make the arrangements to send an ambulance to your home.
All right, doctor.
And after that, we can complete our chat, okay?
All right, doctor. Okay. Yes, doctor.
Okay. So, Myra, in few minutes, ambulance will reach to you, and we can complete our conversation about your son.
All right, doctor. Okay.
Is he having any kind of medical condition before that?
Well, doctor, he was born premature, doctor, and that's it. Nothing else.
And did he have any kind of chest infection in the past frequently?
Doctor, he had one like 6 months ago.
Okay. And apart from that, does he have any kind of condition like asthma?
No, doctor, no.
Okay. And does he have, is he taking any kind of medications?
No, doctor, not really.
And you told me that he was born premature, is that right?
Yes, doctor, yes.
Is he up to date or to all the jabs?
Yes, doctor, he is, yes.
Okay. And with that, Mahira, do you have any other child at home?
No, doctor, no.
Okay. And is there anyone else who can help you with your child right now?
Yeah, I can manage, doctor.
Okay. So, Mahira, is there anything else you want to tell me?
No, doctor, not really.
Okay. And what about his wee and poo? Is there anything wrong with that?
No, doctor, no, no.
Okay. Does he have any kind of cough?
Cough?
Yeah.
He's not coughing really, no. No, but he's having discharge from his nose.
He's having the discharge since when?
I mean, when I woke up him up in the morning, doctor, I've seen discharging from the nose, doctor.
Okay. And did he vomit?
No, doctor, no, no.
Okay. And is he conscious right now?
Yes, doctor. Yes, he's not unconscious. No, he's you know, he's sick, but okay, yes, he's conscious.
Okay, keep an eye on him till the ambulance help reaches to you. Okay, Myra?
All right, doctor. Okay.
Is there anything else that concerns you?
No, doctor, but what's going on, doctor? I mean, what's gonna happen? What are you gonna do? You worried me more now, doctor. Ambulance,
so Myra,
emergency, quick, 10 minutes. It's all sound no good to me, doctors. Is he gonna die?
No, Myra, I'm sorry coming out this way, but I just want to make sure because you told me that he's not breathing, he's have color change, and he's not taking the feed. So these kind of things make me concerned. That's why I called the ambulance so that we can manage him at the time in the hospital, Myra. And it seems like that maybe he's having any kind of chest infection. Are you with me, Myra?
Yes, doctor. Yes, yes.
But we need to make sure so that we can have tests and chest X-ray to see what's going on with your baby.
Right, doctor.
As he's so young, I want a senior to assess him. That's why I called the ambulance, and I want my senior to assess him in the hospital, and maybe he needs oxygen and we need to admit him in the hospital.
All right, doctor. Okay.
So Myra, are you do you have any other concerns for me?
No, doctor, no.
Okay.
Thank you very much. Thank you very much. Thank you. End the consultation.
Okay.
Thank you very much.
Thank you very much.
How many doctors we've seen so far? Remember the faces and the names. We've seen Dr. Nurhan. We've seen Dr. Siwar. Yeah, Siwar. What's the meaning of the bracelet? Yeah. Dr. Siwar. Okay. Dr. Siwar. And we've seen Dr. Durian and Dr. Ghazal. Guys, the four of them are doing great. As far as I'm concerned, ready for the exam, ready to go. Regardless, difficult, tough, I don't care. Who's there, I don't care. Inshallah, they will pass. I repeated again to tell you, the kind of doctors I see, good doctors, good. Ready. better than me when I was doing my PLAB 2 and I got high score. Wallahi, good. Do you know what's going on? Relaxed, chilled, But obviously, some concerns here and there. But in general, I'm happy. Okay. The word ambulance. That's what I was looking for. Ambulance. The word ambulance. That's what I was looking for. Ambulance. At the right time. Doctor, he's not breathing, not himself. Color is turning blue. He's not feeding. Ambulance. We'll ring the ambulance. I will make sure the ambulance is on its way while we are carrying on or while we are continuing our conversation. Ambulance. Is that only in this station? No. At any station you feel something wrong is going on, an emergency going on, a chest pain for a patient, severe central crush, ambulance, any phone consultation. What is the reason of a phone consultation? You are the filtering doctor. You are what? Filtering. Does it need one of three things? So in a phone consultation, you are filtering one of three. One of three. Do I need to bring them to the clinic, the GP clinic? Yeah? Or do they need to stay at home? Or do they need ambulance and hospital? One of three options, you don't have four. So what are the three options you need to filter? Home, stay at home, don't worry, you can come and even pick a prescription from GP without seeing a doctor. Or what? Come to us, and when I say come, it means not emergency. Come, you're gonna come, follow up, we're gonna arrange follow up. Or come now. Ambulance, emergency hospital. One thing you don't miss is ambulance. What do you mean? If a patient should be managed at home and not come, and you bring her, it's fine. Clear. But if a patient needs ambulance and you don't, you fail. So that's one thing. So if your feelings, simple UTI, nothing really, plenty of fluids and that's it, stable, nothing, just some burning sensation, no fever, stable patient. A patient should be managed at home, just plenty of fluid, drink plenty of fluids, empty your bladder. But I brought her to the GP. Any problem? No, it's fine. But a patient is calling you, pain while passing urine, shivering doctor, chills, shivering doctor. Hospital. And you say to her, stay at home or you're going to come in 4 days, you will fail the station. Did you get now the general concept? One of three. Tell yourself before you start the management. Is it a candidate at home or GP or hospital? But one thing you don't miss is if she needs ambulance and hospital, be careful. And that will come from the station. You will feel it as she felt it. Yes. You will feel it. Are you following me? So now, when we start the phone call, guys, anybody has a power bank? Anybody? Yes. Your phone. It's not my phone. It's Dr. Nurhan. Where is she? Is she okay? Is she having a mock or? Yeah. This wireless. So. It's wireless. Yes.
Do you need a wire?
This is for iPhone. I know. Yeah. iPhone. Yeah. Thank you very much. So now that's before we start phone consultation. I want you to know. Please make sure. 1, 2, 3. Clear, guys? If you miss ambulance or urgent hospital, and you will fail. In this patient, I'm sure you know what I'm talking about now. You will fail the station. This patient needs ambulance right away. Do you need to bring him to the GP? No. He needs oxygenation, guys. The guys, yes. The baby is, okay. But she forgot at the end. She stopped after. She didn't tell me what she's suspecting and what investigation is to be done. Did you notice? And I said to her, Doctor, what's going on? You scared me. And I thought you scared me 5 10-15 minute ambulance, urgent. You've mentioned a few words that were alarming to me. What's going on, doctor? Is it a valid concern?
Yeah.
But she should have carried on.
I did my exam. I stopped. Can I call the ambulance or something? So I still have 2 minutes left, and I stopped. I didn't say anything. They gave me 7 days. If I said other things, but I would have done the exam. I would have had the entire station. I was so. When I came out,
They give you what? 7.
7 because I said
You
everything.
stopped. He said I stopped.
They
At
just
the
gave
time
me
she
7.
stopped. Like, no, carry on.
I just carry on.
Carry on. Carry on. Yeah. Understand? Because I don't know. Guys, she mentioned the alarming words. Ambulance, quick, 10 to 15 minute ambulance. You understand? On the way, I'm concerned. But why? Why are you concerned? So let's start the station in a chronological order. In a phone consultation, confirm full name, name of the child, address. Sorry, date of birth. So, again, full name of the mother, full name of the child, and date of birth. Now, enough confirm. What about the address? Guys, the address is for you to mention. Now I'm giving you the typical rules. And you can, in UK, if I confirm on the phone, I say, can you please confirm your full name? Mo Sobhy. Can you please confirm your son's full name? Hamza Sobhy. Can you please confirm his date of birth? Then, are you living in Liverpool, Prescott Road, Anfield? Who's saying are you living? The doctor. So they tell you, when you confirm my identity, you need how many? 2. Full name and date of birth. And then you mention the address. You don't ask, can you please confirm your address? Okay. You do it. It is not wrong. It will not deduct the marks, but I'm telling you the right way. The right way is we say the address. The doctor mentioned the address. They only use 2 ways of confirmation. Full name, date of birth, and then the doctor tells you. The doctor, that's the correct, perfect way. But if you say confirm your address, it's fine. But the perfect way is, are you living at boom 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 boom? Yes, doctor. Sorry? Yeah. In a phone consultation. Yes. In a phone consultation, there is an address. And in a phone consultation, there is a copy of the question inside. Are you following me? Yes. This is the correct way. Are you living at, yes. How can I help you today? Then it will start as a normal station. So in a phone consultation, and you can add the phone. Is that the phone number, the best phone number to catch you in? Yes, doctor. That's it. So full name, date of birth. You tell the address. You say that. Are you living at? Yes, such and such. The best phone number. That's it. Start your station. When you start the station,
should we confirm if it's the appropriate time to call?
In this station, guys, I don't, because she can feel on the phone I am. It says the whole time I need help, so it will be awkward. But Dr. Sameh, if it's a missing blood sample, if it's missing, it's okay. But in this, I was, doctor, like she said, she can feel it. She said, I can feel, and it was very nice, guys. Very beautiful to pick things early. I can feel you are a bit anxious. Is everything all right? Perfect start. Natural start. Okay? So, now you'll start your station as normal pediatric station. I said to her, shortness of breath. She started asking about since when and coughing, and she started. In pediatric, I said head to quick or quick. But where is the system? What is the problem? Chest. So she will focus on the chest. April, doctor. This is just a quick revision now. Carrying on. So if there's something missing, it's a pediatrics station. I'm not going to go through pediatric structure and in details and 2 hours. No, you know what I'm talking about. Yeah. I'm quick recap now. So start head to toe. But before head to toe in a child, focus on the Where is the system? What is the problem? Where is the problem? Chest. Where? What is the complaint I give her?
Not breathing.
No breathing. So focus on it first, then quick head to toe. Quick head to toe. So focus on it by asking about he's not breathing since when, how did it start, has he had this before, apart from that, coughing, any coughing, you know, and then head to toe, any discharge anywhere, but she forgot two important questions, or three. She forgot three extremely important points at any child. Guys, she did not ask about fever. Rash. Fever. Rash. Dehydration. Dehydration. Some of you will say, doctor, but the child seems on the phone dehydrated. I don't care. No, ask clearly. You know the laugh he gave now. You know, by himself كده, he said in his own corner. I told you there's a shade here, no light on him. You understand? Yeah, but I love him. He's a good guy.
Like a brother.
A brother, yeah. So, fever rash. You forgot. Wow, important. Is it important?
Very important.
Fever rash. Any child, you must ask fever rash. And dehydration.
Yes.
Dehydration is not. Have you noticed that he's not himself? Slept a lot. You understand? Floppy. You know. And the opposite of all of this is he active and playful. The opposite of all of this is he active and. But in this station, I cannot ask is he active. Yes, that's what I'm saying. No, that's what I'm saying to you. The opposite. Yeah. If you don't see things going on, you can ask cover all one. Is he active and playful? But in this case, no, you want to ask about dehydration. Yes. So, pediatric cases, head to toe. Don't forget, pediatric cases, head to toe. Head to toe, why? Because a child cannot complain. Your job is any discharge from the ears, from the nose, from the eyes, any fever. You understand? So, look at me now. Head to toe. Guys, can you hear me? Can you hear me?
We can't see you. Sir, we can hear you, but we can't see you.
The camera for some reason is, you know, for some reason it's
okay.
Now uploading now again, but it's fine as long as you hear me. That's the main concern.
Yeah, we can hear you.
Yeah. Yeah. So head to toe at any child. But before head to toe, start with the system. So how can I help you, doctor? My son is vomiting. What is the system? Tummy. So ask the question: vomiting, diarrhea, constipation, tummy pain. But then, Dr. Sameh, after you finish your system, head to toe, but please a question each. What do you mean question each? Guys, question each. Head. What is in the head? Brain meningitis, one question. One question. Fever, guys. Fever. If you want to add, rash. Then come to the eyes, nose, ears. Discharge from the eyes or nose or ears, or is he talking his ears? Come to the chest. Is he breathing well on his own? Any cough, shortness of breath? Then come to the tummy, you've mentioned that. Then come to the urine. The last system, urine is, how's his urine? His poo, wee, any changes? No, yes, that's it. So once you finish the system, what? Please, guys, when I say question each, I mean quick. Don't say. Any fever? No, doctor. Any neck stiffness? No, doctor. Any pain in his neck? No, doctor. If there is no fever, there is no meningitis. Am I making any sense? Any meningitis without fever? So my point is, once you finish your system, quick hit to toe. And don't forget, after quick hit to toe, triple D, one of them is dehydration. So now I'm focusing on dehydration, you forgot. So guys, you cannot have pediatric case medicine without diet and dehydration. Diet, what do you feed him? Is he feeding well? Dehydration questions is he well in himself? Is he active and playful or floppy, drowsy? So what if you want to give us an advice about pediatric, head to toe plus diet and dehydration. Diet, dehydration. Diet dehydration. After that, she mentioned the ambulance at this time because she found that things are going on. Yeah, ambulance is a must. And then she started moving to the. She stopped, but now you cannot stop. Just tell me that I'm suspecting what? Chest infection. That's why we need to bring him to examine. خلاص بقى ما هو examination, provisional diagnosis management. So examination, we need to examine what? We need to check his vitals and his chest. We need to run further investigation, or some investigation, because I'm suspecting chest infection. Okay, so we need to bring him to the hospital for some blood test, chest X-ray, to put him on oxygen, and talk about management. Are you lost? So, but the most important word for me here, once you think something is going on, ambulance. Okay. Another example. Phone consultation. So I said, what is the start of phone consultation? Confirm your full name and date of birth. Then you speak, you mention the address. Then you are taking history. The patient said, doctor, I'm having a skin lesion and it's increasing in size and discharging, oozing. The color is not nice. What is that case? Do you want to send him to the hospital emergency, or do you want to bring him to the GP? GP. Or do you want to say to him, stay at home? No, GP. No, it's a GP. Guys, the station will be one of three. Either hospital, now, ambulance, come to the GP, or home. This case is what?
Ambulance.
This case. No, this one is skin lesion, changing discharge. GP, come. Doctor, can we say we'll refer him to dermatology? You have not seen him yet. To refer him to dermatology. Are you lost? You cannot refer a patient over the phone without seeing him.
Yesterday in the mock, in the California conversation, I have a Dharma case. So
I haven't given my mock.
Okay, so
Please
there was
don't
a
reveal
picture.
the
Let's say there was a picture with me, but I was not sure that I can say that I have a picture with me. So I said that, can you email the picture of your rash to me? The examiner said, okay, I'm going to email you. Then he said, you received it? I said, yeah, I received it. But I was confused that how I comment that I have a picture with me. How to proceed with that?
No. Even on examination, I have the picture here with me. You don't need to comment and is it sent by post or by email or WhatsApp or Viber? No. I have the picture here with me.
I have got
guys?
the picture.
Yeah, you don't need to. I asked him to email, but he doesn't
I
know
got the email, okay?
No, but he doesn't know my email. How did he know my email? The picture is there. The picture is there when you reach examination and the phone consultation. The picture is there for you to say, I have.
I have a picture. Okay.
Don't say that you have emailed it. Is it emailed? Yeah, it is. Okay, I'm gonna have a look at it. No, it's there. Once you reach examination, pick it.
Do you want my email address?
So my point is, in this case, if you're suspecting a skin lesion changing and color, what do you want to do? Come to us. We need to examine the lesion, so we'll arrange a follow-up. Okay? Then start talking about management, because we need to examine it and look at it. You've mentioned to me that it's discharging and this and that and this and that. We'll take a swab, we'll refer you to dermatologist. You understand? As a manager. But you're not going to refer him. You need to see him. But for the meantime, please watch out, safety net, any lumps or bumps anywhere or this or that. And for the meantime, make sure it's not exposed to the sun. Yeah. Clear, doctor? So you know now what I mean by, is it going to be at home? Is it going to be GP to me? Is it going to be? There is no other options. You cannot refer a patient without. It's like me, for example, I'm on call. I get in a call. I'm getting a call, yeah? Orthopedic, yes. There is a patient tibia fracture and this and that. Yeah, but there is a skin 1 by 1, 2 by 2, for example, lesion on the bones. And okay, I think you need plastic. You need to see the patient, then to say where is he going to. You get me? Yes. So, and don't forget ambulance. Don't forget, when there is something, ambulance, and then carry on. Don't stop after you finish history. say what you're gonna do, what you're gonna examine, what you're gonna, and don't forget that when you start the phone consultation, full name, date of birth, and then do you live at? Yeah? Okay? Next. So that was phone consultation and pediatric together. Don't forget in pediatric fever,
Yes.
rash, dehydration.
Yeah, dehydration.
But she mentioned floppy, she mentioned drowsy, so but I wanted the questions together, yeah? Next. Next. Okay. Last station, then we're gonna have a break. Because I know you deserve a break, but like last station, yeah? Okay. Last station before the break. Very easy station. Very easy station. Very easy station. Nigeria. Come. You need to come. Don't tell me I'm not ready.
On Monday.
No, it's not working. Look, stop. Stop, come. And I like to vote on myself, not on the people there. So
Dr. He's from
now
Nigeria as well.
Nigeria as well, yeah, but I've heard him a lot. Yeah, I've heard them in the Galaba mocks and and the same man in the Galaba mock, but I've not heard them before. So what's the name?
Monday.
Monday, yes, I've asked you this. Okay, Dr. Monday, we're gonna give him a station. Very easy station. Very straightforward station. Okay, it is about you are an FY doctor in the medical department. Okay, Mo Sobhy is Ahmed Sobhy's brother. Okay, talk to Mo Sobhy, Ahmed Sobhy's. So what? Who's the patient? Ahmed Sobhy brother. Yeah, it's a very common station, but I don't know why, guys, you don't manage well in terms of do I give antibiotic, do I not give antibiotic? Okay, can you write down the question? Yeah. Mo Sobhy, Ahmed Sobhy's brother. The patient is Ahmed Sobhy. The patient is 85 years old. The patient is 85 years old, been admitted in the hospital for chest infection. For what? Chest infection. The patient was isolated because he developed diarrhea. Because he developed diarrhea. Because he developed diarrhea. Allah, these guys like troublemaker. Because he developed diarrhea. Yeah? Talk to Mo Sobhy, address his concerns. Are you following me? So the question is, Ahmed Sobhy, hospital, chest infection. Later on, he developed diarrhea. You've been asked to, or his brother is Muhammad Mo Sobhy is here. Concern, talk to him. Clear? Let's start. Exam station. Let's start. Can you raise your voice if you don't mind? Or?
I will try to.
Yeah, so just I want them to hear. Guys, we need to keep it quiet. Guys on the side here, are you okay? Do you... Okay, let's start. Guys, please. Begin.
Hello.
Hello.
I'm Dr. Mandy, one of the junior doctors in the department.
Hello, Dr. Mandy.
I'm okay. Are you?
I'm fine. I'm just worried about my brother. What's going on?
Okay, before we go on,
he's isolated. Yeah, he's Ahmed Sobhy. He's 85 years old, and I'm his brother, Mo Sobhy. What's going on? My brother has been admitted in the hospital for chest infection. And today I came to the hospital. He's isolated. He's in a separate room. Everybody's going to the room, apron, gloves. It's like he's a dirty person. Okay. And I saw, a sign on his door that you shouldn't approach the room unless you are gloved and with an apron. And what's going on? I brought my brother with a chest infection, and now, what's going on? He's having diarrhea. What's going on?
Okay, thank you for coming to us. We'll try to address all your concerns. Before we go ahead, may I know what else you know about your brother's?
I know that he had a chest infection. He's diagnosed COPD anyway, and he had a chest infection, and he came about 7 days ago, and they told, or my brother told me he's on antibiotics. He was treated for this infection, but nothing else. But today, I see that people going in with apron, gloves. What's going on?
All right. You are right to say your brother came a few days ago for chest infection, and we treated him with antibiotics because of chest infection. But a few days ago, he developed diarrhea. What you want me to explain to you?
Please, what's going on? Why did he develop diarrhea? What happened?
Okay.
What do you think is going on?
Diarrhea sometimes could be as a side effect of the medications we use to treat him for chest infection.
Okay.
Okay. Now, when we discovered he developed diarrhea, we tested him and we discovered that he has a different kind of bug, different from the one that causes chest infection.
Okay, so different kind of bug.
Yes.
All
exactly.
right.
Are you with me so far?
Yes, yes, yes.
Okay, now to give him proper treatment for this new type of bug, people who have that kind of infection or bug, we usually move them to separate place.
All right.
So that we can give them the best of care
Okay.
that is needed.
All right.
Are you with me so far?
Yeah, I'm with you, yes.
Okay. And because this type of bug is usually very highly infective, okay, that's why we keep him in kind of separate place. And we restrict people access to him so that the bug does not easily spread.
Okay, yes, okay. So now he was on antibiotics for chest infection. And do you think the antibiotic caused it?
Yes, as I mentioned to you, this diarrhea is one of the expected side effects of some antibiotics.
Okay.
So it is highly possible that the antibiotics we gave him for chest infection caused it as a side effect.
Okay.
All right. But what we're doing for him now,
okay,
as we have tested him and we have discovered the bug that is giving him this new diarrhea.
All right.
We are giving him special antibiotics to treat this new bug.
Okay. All right. Okay. Why don't you give him something to stop the diarrhea? Because I'm not happy with him having loose stool like this. So why don't you give him something to stop the diarrhea?
Yeah, I can understand your concerns clearly. But when we have a patient who has diarrhea, it means that this bug is already in their system. And we do not want to keep this bug in the system. So we want the diarrhea to go to remove the bugs. So we do not stop the diarrhea. Instead, we treat the bug itself. And that's what we are doing now.
All right. Okay. Thank you very much. I was so worried. I thought, why is this happening? Is he gonna die? I thought it's something like serious, but thank you, doctor. Thank you very much for informing me about everything.
Yeah, we're doing our best to make sure that he recovers as soon as possible.
Okay.
As you also mentioned, you notice people going in there fully gowned with gloves.
Yeah.
It is because this bug is very highly infective.
Yes.
And we do not want it to spread.
Yes.
Okay. We will also advise you, if you want to see, if you can limit your access to him, it is okay. But if you want to see him,
no, I don't want to see him, no, okay. Because it's highly infective and I'm worried about myself. Let me say what? I want to see him. Don't you ask and answer, but if you want to see him, you told me it's highly infective, gloves, apron, go. No, you get me? No, seriously, do you know what I'm talking about? Yeah. But if you want to see him, I don't want to see him. You've been talking to me, it's highly effective. I'm a sensible person. I don't want to see him. So let me say it. Yeah. Okay? Are you convinced of what I'm talking about? Yeah. Let me talk. Let me say, can I see him? Then you say, well, I can see you are very concerned, but as I told you, but don't say, well, this and that. But if you want to see him, well, we can. No. Anyway, doctor, can I see him?
Yes, we can definitely make arrangement for you to see him.
Yeah.
But as I have mentioned to you that this drug is not very effective, there are some precautions you have to take before you see him.
All right. Yeah, the apron and the gloves and washing my hand before and after and not touching anything, yeah?
Yes.
Okay. Yes. All right, doctor. You are very helpful and very caring, doctor.
And I hope your brother gets recovered as soon as possible. Okay. If there is any other thing you feel like we need to do for you, we're always here to help you.
Thank you.
Always contact us.
Thank you, Dr. Monday. Thank you very much. Give me a hug. Give me a hug. seriously, he's sitting on the side. Seriously, he's chilled. Everybody here is suffocated, short of breath, no oxygen, and he's sitting on his own world. Seriously. Thank you very much. Okay, Dr. Monday, good communication skills. Yeah, reflecting on my concerns, addressing all the concerns. Guys, when we are here, when we give feedback, don't feel offended. I want him to, I want him to pass and text me. I pass Dr. Mo. That's what I'm saying to you. So, there is something called confidentiality. And we only get confidentiality. Look, I am trying my best to fight script. People only know confidentiality. The station consultant, surgeon son? Yeah, confidentiality. That's it. So in the hospital, the only confidentiality that will come to you in the future, surgeon son, consultant, his mom. That's it. No, confidentiality. The mother, her daughter, she found COCP pills in her pocket. No. Confidentiality can be any station. Confidentiality can be? So any station can be confidentiality. If a brother coming and the patient is he unconscious? Is he anything? Please, confidentiality is a huge topic. But Dr. Mo, why do we, if I let Dr. Monday not read any scripts, go for it, he will realize. But if I would have told him, surgeon son, this is confidentiality. This is the station of confidentiality. Now we know. Now ask about consent and fight with him. Yeah. But this, same. So the surgeon, the son who wants to know about his mom, confidentiality. But the brother wants to know about his brother, no confidentiality. You get what I'm trying to say. So confidentiality. You did the station well, but it was confidentiality. But you did it well as this one. You get it? Yes. Small trick, but it's fine. Sorry?
Yeah, I had this to ask, but I forgot again.
You had the class.
No, I wanted to ask that question.
The question, but I forgot. Yeah. That's why, guys, in the mock, even in the mock, people say, I asked you this, but they wrote for me. You didn't ask. You thought you will ask. So at the door, in the mock, on the exam, I will ask family history, sexual history, contact history. Then you go and you don't ask it. But deep down in your head, you asked. You thought you asked, but you didn't. Thank you. Thank you. May I ask, what do you do? What's your specialty? What's
I'm a radiologist.
Radiologist.
Radiology resident, actually.
Yeah. Back home. Yeah. The best specialty in UK. Radiology. Seriously. Yeah. The best. Chilled, nice, no headache, no. You are sitting in Australia, reading the images for UK patient and getting paid. That's it. There is no, no headache. Anyway, so. Yes. Yes. No. But he said no. Did you hear him? He said it could be side effect. It could be. He said to me it could be side effect of antibiotics. I don't know if you heard him or not.
He said it could be antibiotics.
It could be the antibiotic, it could be side effect, but the fact is isolated and things, usually we isolate them because we are suspecting Yeah, yeah. Because once the patient is having diarrhea in the hospital, you don't wait to know it's secondary disease. You isolate them, then you start the investigation. Okay, so it is a confidentiality station. Hi, do you have a consent? No. Bye. It's gonna be like surgeon son. Seriously, it's gonna be like surgeon son. So this is surgeon son who wants to know about his mom because she has cancer. Guys, by the way, you need to know something here. I'm not deviating you from PLAB. I'm not deviating you from, but I'm saying confidentiality can be any station. Do you agree? How do I mean, or why did I do this? I had about a year and a half ago 8 doctors in one batch in the exam. 8, yeah, 8 doctors in one batch. Morning 8, and that was one of the stations. Okay, exactly like this. Then when people after the exam they want to discuss the station with me, I say, listen, we don't want to. I mean, guys, what happened happened. Wait for the result. I don't like to stress you out and enjoy your life until you have the result. And at the result day, I follow up people what happened, and I want to know what's going on as well. So 6 out of the 7. First of all, the passing score was 2. seriously, the passing score in the station was 2. 2 out of 12. 6 out of the 7 failed in this station, like 1, 0, and the passing was 2, and 1 finished in 2 minutes the station and passed the station. 12 out of 12. Then we spoke about, yeah, it was confidentiality. It was not, because even me, because I'm not there, I don't know what happened. I am not there, but I want to speak to the people and I start analyzing things, and it was confidentiality. Student difficile, confidentiality. Why? Because they are want to give you a message. Confidentiality is anything. It's not just surgeon son, mother or daughter. No, anybody. So just confidentiality. So please, at any time, let me give you this message now. If I am conscious, I have mental capacity, I am the one who will take decisions. Who will what? Take decisions. And I am the one who you will discuss everything with me. I am the one. I am the top. Okay. In the exam, whenever you are talking to relative and the word consent is not mentioned, ask, do you have a consent? Doctor, they will be offended. No, it's fine. Do you have a consent? Yes, done. No, I'm sorry. So again, whenever in PLAB 2 you are talking to a relative, if in the question it is mentioned consent is taken, don't ask. If it's not mentioned, you have to ask for a consent. Is there any situation where I don't ask for consent? If the patient is unconscious. If he's unconscious, you're gonna say, did he give you consent? No, he's unconscious. He's unconscious, doctor. So if he's unconscious only, that's when talk to wife, you will talk, because he's unconscious. Clear? Guys, is it clear or so? At any station.
Again, doctor, again.
At any station, you are talking to relative, daughter, mother, sister, brother, anybody. If the question outside it is written, consent was taken, is fine. But if it's not mentioned, what should you do? Ask. Don't worry. Alicia, I'm sorry. Do you have a consent? Yes, doctor, I have a consent to talk about. No, my mom's condition. That's it. Talk. But if it's mentioned in the question, they are telling you consent is.
We ask the relevant relative.
If it's mentioned in the question, guys, outside, consent is taken. Halas, go and talk. No problem. Consent is taken. If it's not mentioned, if
Dr.
it's not,
Mo, I have a
ask the
question.
relative. Yes. Yes, guys. Yes.
Isn't there a possibility that the patient
Dr. Mo?
You mean the relative? No, it's not your problem here, guys. Guys, it's not. Don't worry. Someone said, what if she's lying? It's it's, understand. Don't worry. They are not like. They just want to know. Do you know about confidentiality or not? Consent or not? But in real life, it is mentioned on the system. It is mentioned that next of kin, power of attorney.
Should I take the consent from the mother?
Guys, there is no mother. Guys, in PLAB 2, if you are talking to a daughter about her mother, there is no mother. So as simple as they have a consent, yes. Done. That's in the PLAB 2. Don't overthink it. In UK, in the system, when I open my system, when I open the computer, I see the patient, next of kin, power of attorney. So if I have a call or I've been asked to speak to someone, I know who's the power of attorney, who's the next of kin. So can you confirm your full name? Yes. Patient full name? Are you there? Yeah, I know she is the next of kin. I know she's the power of attorney. But in PLAB 2, you don't have a computer. No. So as simple as, if it's mentioned in the question, consent is taken, it is taken. What if it's not mentioned?
You ask.
That's a ask. Doctor, what if they lie? They're not gonna, guys. If they said yes, it's yes. Clear. Don't be shy to ask. Okay, why Dr. Mo? Because my wife doesn't have the right to know about my condition without my permission. The only way, if I am clear. So even if my wife wants to know, to discuss about my condition, as long as I am conscious and have mental capacity, she doesn't have the right. You have to ask for my consent. Am I clear?
Yes.
Oh my God, your wife? Yes, my wife, my son, anybody, nobody needs to know about my condition without, as long as I am conscious and have mental capacity. Clear? Is it clear? Seriously, if you have any doubt, ask me. Yes.
What if the consent is not taken already in the station? Do we first take consent and then proceed?
Yes, first ask. What if the consent is not mentioned in the question? What if the consent is not mentioned in the question? Ask. Clear? Now.
Okay.
Now, that is giving us the topic of
Dr. Mo, please.
confidentiality. Nobody needs to know about my condition without my permission, as long as I am conscious and have mental capacity. That's it. Consent from anyone.
So, Dr. Mo,
Do we ask you are the rest of the
if unconscious, whoever is there will be talking. Yes, boss. Because
Dr. Mo, if there
yes,
is no consent, the station will end.
Sorry?
If there is no consent, if the relative has no consent from the patient, so the station will end.
Perfect. He's saying, what if the relative does not have consent? It will become like surgeon's son. Well, I want to know. Well, I'm really sorry. I'm obliged. Well, I need to know. Well, you know, if it was you, would you really need anybody to, you understand? It's going to be a challenging station of the same challenging station that we know. Doctor, when you follow our course later on in the videos, I think you did not watch the videos yet, I think.
Yes.
There is a station about if there is a relative and he wants to know and he doesn't have consent, what to do? It's a challenging station. What to do if there is no consent? Okay, anyway.
Thank you.
I will mention it now. So far, guys, this topic is important. Yeah, please. It's important because if you understand it, you don't need script. You understand it? That's it. So, as long as I have mental capacity and conscious, do you need consent from anyone? You need consent from anyone. Wife? Yes. Wife, guys. Imagine of the STI station. Don't tell my wife. That's it. Don't tell my partner. Yeah, I have the right. So, if I am conscious and I have mental capacity, can you tell anyone anything without my consent? No. Done. That's clear. That's even his wife, anybody. Clear? Come to the second stage. The second stage, if I am unconscious or I don't have mental capacity. You remember there is a station. The mother has a had wrist fracture, the left hand. she fractured her wrist, and now she's ready to go home. She's happy to go home. Everything is sorted at home, and the son doesn't want you. And it is written that she has mental. She go home or not? Yes. She wants to go home. What if the son said, no, I don't want her to go home? Can he make decision? Why? And you have to mention in PLAB 2 station, your mother has capacity. I'm sorry to come across that way. I can see you are concerned, son, but she is the one that will take decisions. So, and you must tell the examiner, I know why she's the one, because she has capacity. You need to verbalize it to the son. Okay, another station, a son who's telling you, don't tell mom that she has cancer. CT scan showed cancer. Don't tell her that she has. And it is written in the question, she has mental capacity in the question. Guys, you need to show the examiner. I know why she should know, because she has. And he will tell you, doctor, 2 weeks ago, it was me making decisions. Why now not me making decision? And yes, I totally understand where you come from, but 2 weeks ago she did not have. Now she has capacity, understand? Yes, you will make a decision. Yes, because she did not have, but now she does. So it's all about mental. She knows what's going on. She's conscious. She's the one. Okay. So anything else comes after is if the patient doesn't have capacity. Let's talk now. We have two people. We have next of kin and we have power of attorney. That's it. I don't want to know anymore. We have next of and we have power of attorney. But I said something I hope you all understood. Can the power of attorney take decision if I have mental capacity? No. So the power of attorney and the next of kin comes after you become unconscious. Oh my God! So I have my daughter. She has the power of attorney. She should take decision. If you are conscious, if you are stable, if you have mental capacity, it's you. Are you clear? Yes. So power of attorney and next of kin. Next of kin, write one word: update. Right next of kin in brackets, update. What do you mean by update? So next of kin is not to take decision, is not to decide for me, is only to be updated. Power of attorney, decisions. That's it. Right next of kin, update. Next to power of attorney, decisions. What do you mean? So power of attorney, they make decisions for me, and the decision, health decisions, and sometimes financial decision, legal decision. But the next of kin can make decision? No. Just for? Hi, doctor, I don't know about my mom. Yes, you can. Boom, 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 boom. Update only.
Who will take decision then?
Sorry?
Who will take decision? No, if there is no power of attorney, just next of kin.
No. Here the all solicitor power of attorney, all of them. Yeah. But what if there's no power of attorney? So best interest. Best interest, of course. So online doctors. I have mentioned, I know it's too much for you to absorb today, but I'm just talking about plenty of topics in one session. Sorry? Yeah. I've mentioned if the patient has mental capacity, conscious, everybody should have consent to talk about. Dr. Monday, if there is no consent, can you talk about anything? No. Now coming back, if there is no mental capacity or the patient is unconscious, then let's talk. Two people will be involved. Next of kin and next of kin only for update. Power of attorney for decisions. Clear, guys? I'm telling you, clear definitions. I could be talking for some people when you give lecture about this, they talk for 3 hours, but you lost. Seriously, you lost. Like.
So, Dr. Mo, just a question.
Next of kin update. Power of attorney.
Dr. Mo?
Decisions, and this will come if the patient is unconscious. So if I am conscious, I have mental capacity, I am the one that they will ask me. They're not going to ask about it then. Okay? So let's move
Dr.
on.
Mo,
Yes, doctor?
Even if I am conscious, even the next of kin cannot
what do you
give
say, sorry?
any...
Can you repeat again, please?
Even if the patient is conscious, we cannot give any update for the next of kin?
No. If the patient is conscious, conscious, and there is a next of kin who wants to know, yes, they cannot be updated. Yes, of course. The mother, the father, the daughter, they want to know. They know. But I'm saying decisions and things, no. But I said next of kin just for update. Okay, I am.
Okay.
I am
But
conscious.
even
I
if
am
the patient
conscious.
is conscious.
I have mental capacity. My daughter is the next of kin. She wants to know about me. Yeah, she knows. Fine. But
Without
she
taking
cannot.
any consent.
Sorry?
Without taking any consent.
Well, again, he's saying without taking consent. Again, in PLAB 2, consent must be mentioned in the question. Consent must be. Or in PLAB 2, they must say daughter is the next of kin. But in real life, I have this patient documentation. So all what I need to know, who's the next of kin? Oh, Alicia. So Alicia is talking to me, she's the next of kin. Clear, doctor?
Okay, clear. So just for clarifying, next of kin is every time can give an update.
Yes. Yes, next of kin for update. Next of kin for update. Yeah, next of kin for update. Part of attorney decision. Decision only if I cannot give decision, if I cannot make decision, if I'm unconscious. But the next of kin is next of kin. He's update even if the patient is conscious, unconscious. I want to be updated about my dad, and I'm the next. I can update. Yes. Guys, we're gonna have a break now. Yes. 1 second. 1 second. Yeah.
Doctor, please send the link after the break so that we can also.
If the son doesn't want her to go home, but she won't, she can. Yeah. No, you can go and discuss with her. You can go and talk to her, but she wants to go. She has mental capacity. That's what she wants. But in management, yes, yes, that's it. She can use the dominant hand. Yes. Guys, we're gonna create another meeting after the break. The break is till 3 o'clock, and then we're gonna have 1.5 hours, and then that's it. Okay? Break for
Yes,
half an
doctor,
hour.
please send the link on time because we really
Here, I
want
almost
to
send
hear
it. I
it.
almost send it on time, but I
Thank.
started late. That's all. I started late.
Okay,
Thank
okay,
you.
doctor. Thank you.
Doctor, we need a prescription.